We'll call the Wicomico County Council meeting to order at legislative session 2026-10 for May 19th, 2026. Invocation this morning will be from Reverend Howard Travers with the New Life Church. Good morning. How are you?
Good morning, everyone.
Thank you for being here.
Good morning. Council and staff, guests, would you join together with me in prayer? Almighty God, creator and sustainer of all life, we thank you for the gift of liberty and responsibility as leaders of this great county. As we meet this morning, we look to you to guide our words and our actions. Let our discernment this morning be wise over the difficult issues we face. Grant us strength to persevere in the ways that make for peace. Open our eyes this morning that we might see the goodness of what we do here in this room. Open our ears that we may hear your voice and the will of all your people. Open our hearts that we might be kind and compassionate in our responses in what we do here today. Grant us your wisdom and direction that we may know the right decisions to make. Grant us your strength that we might resist that which draws us away from unity and good and fair judgment. We humbly ask that you strengthen our courage, strengthen our resolve to stand up in defense of those difficult issues we know to be just and in accordance with your word. That as night falls and our duty here is done, we may know the deep contentment of work completed, which honors our great county, honors our state, makes proud our family, but most of all, honors you. In the name above all names, amen.
Amen. Thank you. Those who would like to stand and join us in the Pledge of Allegiance, please do.
I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Entertain a motion from council to approve the consent agenda.
Move. Second.
Motion second. Any discussions or corrections? Seeing none. All those in favor say aye.
Aye.
Opposed? Motion's carried. Consent agenda passes unanimously. We have a proclamation this morning to recognize National Children's Mental Health Matters Week. And we have Carly Rue and Caleb Foltz and Chris Bozick, representatives of Life Crisis. The proclamation will be presented by Vice President Merritt.
Thanks for being here. Thank you very much. Welcome. Good morning, everybody. I'm proud to read this proclamation for Children's Mental Health Matters Week. Whereas mental health is a key component in a child's healthy development, and Children's Mental Health Week provides the opportunity to focus on this important matter. And whereas, according to the United States Department of Health and Human Services, 1 in 5 children is diagnosed with mental health conditions. And whereas research has shown that early identification and treatment of mental health disorders among children provides better opportunities to lead full and productive lives. And whereas children and youth with mental health challenges and their families benefit from access to services and support, and also benefit from the integration of behavioral health in primary care, education, and child welfare. And whereas it is important that families and communities learn about warning signs of mental health disorders and where to obtain necessary assistance and treatment. Now, therefore, the Wicomico County Council hereby proclaims the week beginning May 3rd, 2026 as Children's Mental Health Matters Week and calls upon all citizens to observe this week in an effort to raise awareness of children's mental health, done this 19th day of May 2026, and it's signed by all members of the Wicomico County Council. Thank you. Which one of you would like to speak? Or both of you?
I'll just say just a couple words. I just want to thank you guys for the recognition and bringing awareness to this. Mental health affects every single one of us. So thank you guys for this attention to this matter, and just we appreciate it very much.
Thank you.
Right up front. Okay.
Ms. Hurley. How are you?
Good morning, Council President, council members, ladies and gentlemen. The first item on the agenda this morning is Resolution Number 74-2026. This is to authorize the county executive to accept a grant from the Local Government Insurance Trust to provide, quote, "Stop the Bleed," end quote, training in the amount of $4,600. And we have Madison Horner here with the Department of HR if there's any questions.
Entertain a motion from council to approve Resolution 74, 2026.
So moved.
Second.
Second.
Discussion? Seeing none. All those in favor of Resolution 74, 2026, say aye.
Aye.
Opposed? Motion is carried. Resolution passes unanimously.
Okay, next is Resolution Number 75-2026. This is to authorize the county executive to accept a grant from the Maryland Energy Administration to implement the Solar App Plus permitting software in the amount of $10,000. And we have Tracy Taylor here, our Department of Planning and Zoning Director.
Entertain a motion from council to approve Resolution 75, 2026.
So moved.
Second.
All right. Any discussion? All those in favor say aye.
Aye.
Opposed? Motion is carried. Resolution passes unanimously.
Okay, the next items are 4 resolutions related to the recently adopted FOP collective bargaining agreement. These resolutions are to amend the pension plan and the personnel manual, so they are consistent with the terms of the collective bargaining agreement. The first one is Resolution Number 78-2026. It's adopting Amendment Number 2026-01 to the retirement plan for employees of Wicomico County and the Board of Education of Wicomico County.
Entertain a motion from council to approve Resolution 78, 2026.
So moved.
Second.
Second.
In discussion. And,
Mr.
Rumenhoff
President.
is here. Yes, Mr. Benson.
This resolution, as Ms. Hurley said, relates to the collective bargaining agreement and bringing the county personnel manual and the retirement plan into accord with this CBA as amended. There are 4, item 3, 4, 5, and 6. Ms. Hurley and I reviewed these. We understand and don't have any issues with numbers 4, 5, and 6. Resolution number 78, or number 3, 78, 2026, is amending the retirement plan. We reviewed that, and we had questions with regard to that. I tried to get a hold of Andrew yesterday afternoon. Unfortunately, we were not able to connect. We need to get answers to those questions, specifically on the amendment.
Mr. Chair, I apologize for interrupting Mr. Benson. My understanding is Smith and Downey, the pension plan attorneys, on Zoom. So rather than have Mr. Benson state the issues and then have to restate them, can we get the pension plan attorney? Because they drafted the majority of this amendment.
Are they on the Zoom now?
They are on Zoom. Yep. You can address your question.
Could
to them.
they announce themselves so that we have it for the record?
Yes, Tyler Downey from Smith & Downey joining. How are you?
And Barry Downey from Smith & Downey.
Is there any way to turn their audio up?
Mr. Downey, can you turn your audio up on your end?
Yes, is this any better? Tyler Downey, Smith & Downey joining.
See what they can do
It's a
back
little
here.
better. Let's see what we
Hang
can
on
do
one
on our
second, sorry.
end.
Thank you, Andrew.
Thank you. Sorry for interrupting.
It's all right.
Additionally, staff is present if there are any specifics about the process that staff can answer.
Okay, thank you. Mr. Benson, thank you.
So if you, attached to the resolution is an amendment, and in the amendment, there are 8 items. If you look at the 8 items, generally there is a date used of July 1st, 2024. Frankly, Ms. Hurley and I did not understand the use of the date 2024. We thought it should either be 2023 or 2026. There may be a logical explanation for it, but we didn't understand it. In sections 1 and 2, assuming that the dates are understood, we didn't have issues with that. In sections 3, 4, and 5, it refers to section 3.12. We thought that it should be section 3.13 based on the retirement manual that we have. That's a minor change. But if you look at sections 3, portions sections 3, 4, 5, specifically number 5 particularly, it refers to the DROP program. And if you look at the CBA does not specifically reference the DROP program, at least not explicitly. And the question that I have at least is, if the CBA did not change the DROP program, why is it included in this amendment? There may be an explanation for it that is more technical than either Ms. Hurley or I understand, but we would like an explanation for that. So those are the questions we have. So the question is whether council wants to address those during this meeting, or you want to table this and deal with it before the next meeting and bring it back. I would simply note that the items on your agenda, items 4, 5, and 6, we don't have any issues with those today, unless council does. But it's just that as it relates to item number 3.
So you didn't have any problem with, okay.
We don't have, I didn't have any issues, and I think I speak for Ms. Hurley as to Resolution 79, 2026, Resolution 80, 2026, and Resolution 81, 2026.
I understand. I thought you meant amendments.
No.
I thought you were referring to
No.
amendments.
So those items on your agenda, we don't have issues with. It's just literally Resolution 78, 2026.
Bob. Andrew.
Mr. Downey would be the individuals to address Mr. Benson's question, because those are specifics that they drafted, so.
Can anyone hear me?
Barely.
I can address those. The effective dates, we can easily change. We worked with the county executive's office on those dates, as some of them were specific pension plan changes that had an effective date before the effective date of this new CBA. So we're capturing intended edits that were a bit historic. Again, we can modify those as requested. We tried to capture everything in this new CBA, almost identical language. And then as for the drop provisions in section 3.12, we need to address how the CBA impacts FOP individuals who are in the drop program, because otherwise those edits would not be captured and some participants covered by the CBA would not be impacted properly. So we were not drafting pieces that were not intended by the CBA. We were just implementing those changes for all impacted individuals.
Well, I mean, the first issue is a simple housekeeping. In the retirement plan, on page 23 of the retirement plan for the county, we believe that the sections that are referenced in items, on the amendment, in items 2, 3, 4, 3, 4, and 5, in there, it's referenced as 3.12. On page 23, the drop program is referenced under 3.13. So we believe that there should be an amendment to this to change that section reference. That's just a housekeeping matter. The larger issue is that while, if I understand correctly, they're trying to change the drop or make the drop program consistent, but it's not part of the CBA. I don't think it was in the CBA. I've looked at the CBA agreement. It doesn't reference the CBA. And for instance, in number 5, which is at the bottom of the amendment, section 3. It's referenced as 3.12E, Roman numeral 2. The drop program has language added on the second page for the purpose of calculating the amount described in A. A member elects to become a drop participant may elect to apply any portion of the unused sick leave effective July 1st, 2026, catastrophic leave credited to the member's drop participation date. Now, that language is in the CBA, but in the CBA, in section 8, section 17D, sick leave refers to the pension benefit. And it may be that that there's a technical reason why the drop program and the pension program are the same and should be treated the same, but that's not what was negotiated in the CBA. And that's the reason for the question.
And then the effective date.
Table this. Excuse me?
Make a motion that we table this
There's a motion to table. Is there a
till we
second?
get answers to these questions.
There's a motion to table and a second. All those in favor say aye. Aye. Opposed? Motion is carried. Resolution 78, 2026 has been tabled unanimously.
Next,
I will coordinate with Mr. Benson and the Downey Smith Law Firm to get written answers to the inquiries, and
That'd be
if
great.
we need to amend, we'll make those amendments
Okay.
before the next meeting. We just need to get this done by the second meeting in June.
Good.
Thank you.
Thank you.
next is Resolution Number 79-2026. This is to amend Chapter 15, Title Leave and Holiday Benefits of the Wicomico County Personnel Manual, Section 1507, entitled Sick Leave, to implement Paragraph D, Article XXB11, pension of the 2026 collective bargaining agreement between Wicomico County, Maryland, the Office of the Sheriff of Wicomico County, and the Wicomico County Fraternal Order of Police, Lodge Number 111.
And motion from council to approve Resolution 79, 2026.
So moved.
Second.
Second.
Any discussion? All those in favor say aye.
Aye.
Opposed? Motion is carried. Resolution passes unanimously.
Okay, next is Resolution Number 80-2026 to amend Chapter 15, Leave and Holiday Benefits of the Wicomico County Personnel Manual, Section 1511, entitled Personal Leave, to implement Paragraph D of Article X1B, Vacation, Holidays, Days Off, and Special Leave of the 2026 Collective Bargaining Agreement between Wicomico County, Maryland, the Office of the Sheriff of Wicomico County, and the Wicomico County Fraternal Order of Police, Lodge Number 111.
And a motion from council to approve Resolution 80, 2026.
So moved.
Second. Any discussion? All those in favor say aye.
Aye.
Opposed? Motion is carried. Resolution 80, 2026 passes unanimously.
Next is Resolution Number 81-2026. This one is to amend Chapter 15, Leave and Holiday Benefits of the Wicomico County Personnel Manual, Section 1507, entitled Sick Leave, to implement Paragraph C of Article X1B, Vacation, Holidays, Days Off, and Special Leave of the 2026 Collective Bargaining Agreement between Wicomico County, Maryland, the Office of the Sheriff of Wicomico County, and the Wicomico County Fraternal Order of Police, Lodge Number 111.
And a motion from council to approve Resolution 81, 2026.
So moved.
Second. Motion second. Discussion. All those in favor say aye.
Aye.
Opposed? Motion is carried. Resolution passes unanimously.
That's all I have, Mr. President.
Thank you, Mrs. Hurley. At this time, we adjourn from legislative session and convene as the local Board of Health. All those in favor say aye.
Aye.
Opposed? I have a report on the health of the county. Mr. Matthew McConaughey, our health officer, our local health officer, is here.
Thank you all. Matthew McConaughey, I'm the health officer from Wicomico County, and I have Christina Gray, my planning and assessment program director, and also the epidemiologist for the health department. If you just bear with us for a second as we get our presentation ready.
All right. Could have recognized Delegate Barry Beecham. You were hiding back there. I didn't see you. Good to see you, Delegate.
I was gonna, I'd have to really wing that one, I think.
as this gets pulled up, just a note, there have been a few communicable diseases that have been making the rounds across the United States and even within the state of Maryland. One is the hantavirus. We're currently monitoring 2 individuals across the state, none located in Wicomico. These are individuals who had travel exposure. So this was from the cruise ship. They were on an aircraft and were not directly exposed to the virus from the cruise ship. They were exposed via another passenger on the ship. Right now, transmission is very low for any person to person, and there is a low risk of any potential outbreak here in the state of Maryland. The hantavirus has many strands. Endemic to the United States is usually west of the Mississippi and areas of New Mexico and Arizona. The other, we have had 3 measles cases in the state. Those have been all travel exposures. Again, none have been in the Wicomico County area.
Good morning. Again, my name is Christina Gray. I'm the Director of Planning and Assessment for the Health Department, as well as the epidemiologist. So this morning, I'm always this mic. Okay, there we go. For today's Board of Health update, I will review several recent initial or statewide health initiatives that hopefully are going to have a huge beneficial impact here in the county, as well as some brief overviews of trends from the recently published Youth Risk Behavior Survey. That's done every other year in Maryland middle and high schools. And then finally, Mr. McConaughey will provide some updates from our Environmental Health Division. I did have a few other notes about the hantavirus. These comments were drafted before this really hit the news, but just kind of the overview. I think Matthew did a good job. We average about between 20 and 40 cases in the U.S. per year. They are concentrated in the Four Corners region, west of the Mississippi. But the concern, even though there's a low case rate, is that the case fatality rate is about 1 of every 3, right? So low case numbers overall, but the fatality rate is definitely of concern. The current situation, we have 41 exposed Americans that are being monitored. Roughly a dozen of those folks are out in Nebraska at the quarantine facility. You may remember from 2014, I think, that Ebola outbreak that impacted the U.S. Same facility. Then there were some other Americans that left the ship early, and they are also being quarantined and monitored across a handful of states. But just to reaffirm, no cases have been identified here in the U.S., including one person that originally had a false positive, but confirmatory testing has confirmed that that person does not have the disease. So, okay.
Just because you mentioned the Ebola, I guess I saw on the news yesterday that all across Africa, there's a lot of various strains of Ebola that have popped up. We don't have any issues like that now yet.
No, in fact, this morning, right before I walked out the door, grabbed a few notes on those. The latest is that the U.S. is going to step up enhanced screening at airports, of course, from the regions affected right now, which are Uganda, the DRC, and South Sudan. So as far as we know, that's where we're at. There is one American doctor who has tested a positive and was evacuated to a facility in Germany. So, but right now, so far, so good. Increased screening, again, at those travel spots. Okay. As a reminder, our mission statement for the Health Department to maximize the health and wellness of all members of the community through collaborative efforts, through our vision to see healthy people in healthy communities. So there is a lot going on at the state level that will involve local health in the next few years. And so I apologize for any alphabet soup that's getting ready to come the way over the next few slides. A lot of acronyms, but the first thing we're going to talk about today is the AHEAD model. AHEAD stands for Achieving Healthcare Efficiency Through Accountable Design. Simply, this is a Center for Medicare and Medicaid Services CMS waiver program that allows states and healthcare providers some flexibility in testing new models and goals towards achieving major objectives. Those objectives include things such as improving population health, and decreasing the burden of disease, of course, in our communities, expanding primary care to increase access for our residents, incentivizing hospitals and specialists for the quality of care that they're providing, and of course, reducing the burden of healthcare costs for taxpayers and our residents. Waiver programs are not novel here in the state of Maryland. They've been around since the late 1970s, starting initially with a program that lasted until 2013 that allowed the state to set its own rate and cost controls for hospitals. This was then expanded into our all-payer model in 2014, which essentially said, hey, here are these global budgets for hospitals. This encourages quality over quantity, right? So we don't want to encourage increased volume just to make increased revenue for things that are avoidable, such as preventable hospitalizations. Then we moved into our total cost of care. This then acknowledged, hey, this isn't just about hospital systems, right? The whole continuum of care includes primary care facilities, skilled nursing facilities, and other health professionals, and the interplay between those systems so that we can reach better population health and achieve those cost-cutting objectives. Finally, in 2026, we are here with the AHEAD model. This is the next iteration of the CMS waiver. And this phase requires us to report on a Population Health Accountability Plan, or PHAP. CMS did require Maryland to select 6 population health measures to monitor over the next 10-year cycle. We also have to have targets for each of these domain areas. The measures come from 2 major data sources: our Behavioral Health Risk Factor Surveillance System, which is our randomized survey that's administered annually to adults here in the area or throughout the state, that focuses on risk behaviors, chronic health conditions, preventative services, as well as another data source, which is an all-payer claims database. And so this is a huge aggregate of data that looks at medical, dental, pharmacy claims across private and public insurers. The 6 AHEAD measures that were selected in the state of Maryland, and therefore also will have to be monitored here at the local level, are self-reported health status. This is the proportion of adults reporting fair or poor health in the previous year. Colorectal cancer screening rates, again, looking at eligible 46 to 75-year-olds receiving at least 1 colorectal screening of any type in the previous year. So again, we tend to think colonoscopy or sigmoidoscopy, but we also have newer technologies now for those at average risk, things you may have seen such as like Cologuard on TV, different types of screening. Hemoglobin A1C control, this looks at the proportion of adults 18 to 75 with either type 1 or type 2 diabetes that has their most recent A1C value of less than 9%. We also look at follow-up post-mental illness hospitalization. This is looking at the critical 7-day and 30-day post-discharge follow-ups for primary mental illness conditions among those 18 years and older. All-cause unplanned readmission. This is, again, looking at quality over quantity, right? So this is the ratio of looking of the actual unplanned readmissions being less than the number that you expect. And then finally, food insecurity. This is another very strong priority for the state right now across several different initiatives. And this measure looks at the proportion of those adults that report always experiencing situations where their food supply runs out and they did not have the resource to buy more.
Question.
Sure.
On the prior slide, you were talking about major objectives. The last three bullet points provide care through expanding advanced primary care, and then talk about rewarding hospitals and specialists, and then taxpayers and patients controlling health care. Can you elaborate on those and how that might be involving businesses as well?
Well, this model specifically looks at how the payment, incentivizing certain performance measures for healthcare providers. So meeting those quality metrics and how that budget, is how the payment system is made. So businesses specifically, I wouldn't.
I think there's options for coordination. There's a few programs that stem off of AHEAD, like HOPE, And then, of course, there's a few more that we'll get into, like the Rural Health Transformation Plan. Those have options for businesses to become involved and to see revenue gain or expansion of services. So we are in a healthcare provider shortage area. So, advancing, expanding primary care is a prerogative of not just the health department, but also of Title Health and other providers in the area. And then, of course, with taxpayers and patients controlling healthcare spending, the way the Maryland model works is there's a total budget associated with it. So you can do 100 services or you can do 1,000 services. Your total income is fixed at one rate. So it doesn't fluctuate. There's not cost scaling or things of like that nature in Maryland, which comparable to other states can occur. So it makes sure that we maintain like our Medicare, Medicaid taxpayer budget.
I will say, though, in terms of the private sector, encouraging, our county to be a warm place that providers want to not only train, we have a great resident program that is expanding, but we want them to stay here, right? So I think that's where maybe the private sector and businesses and just kind of what does that look like, the whole landscape of the county to be more welcoming for providers to want to stay. So
Does that also include like reimbursement processes being more efficient?
Yes. So this model speaks to improving those processes. Yeah. So I didn't want to be too data heavy. I know some presentations I have a lot more data, but I do want to give a baseline on each of these 6 areas. Any disparities that may exist, as well as any current local initiatives that are already in place related to these measures. So first is our self-reported health status. Currently, 16.5% of Maryland and 17.7% of Wicomico residents report fair or poor health in the past year. Unfortunately, a trend we have seen worsen slightly over the past few years, both in the state and the county. For a head, our target here is 16.5% or lower by the end of the period in 2036. And when we do look for any sort of disparities in this data, the latest BRFIS did find upwards of 1 in 4 Hispanic adults are reporting this fair and poor health status. Again, so 25% compared to an overall value of 16. Locally, our Community Health Improvement Plan, and so again, that's another acronym, our CHIP, which is our partnership with Title Health and Somerset County Health Department. Our big work plan addresses some of these strategies around improving health, specifically increased access to care through enhancing the community health worker workforce, strengthening our electronic health referrals, retention of medical residents that are in the area to stay and keep their services here, as well as reducing stigma around accessing behavioral health services. So this is something that is ongoing as we speak. Next is colorectal cancer screening. Currently, 49.3% of eligible Maryland and 47% of eligible Wicomico residents have reported at least one screening in the past year. CMS would like to see us raise that to 54.6% by the end of the period. And while we haven't reached that target yet, overall the trend shows really strong positive growth for the county and the state. And so to put that in perspective, in 2018, the county only reported 1 in 3 eligible adults with a recent screening, and we're now up to 47%. So in my mind, that's huge growth in a short amount of time. Overall, we have seen the incidence and mortality from colon cancer fall over the past 5 years in the county, but I do want to caveat this with the spotlight on younger age groups that I think is actually getting a lot more national attention, unfortunately, due to diagnoses and unfortunately deaths, among those of celebrities and things like that. In March, the American Cancer Society produced an analysis. It did report colorectal cancers are the leading cause of cancer death among those 50 years and younger. So while overall the incidence of mortality has decreased, it's really driven by older age groups. The incidence of colorectal cancers in those 20 to 49 years of age, though, has increased 3% annually from 2013 to 2022. So while the etiology of this increase, of course, is yet to be pinpointed, there's a lot of focus on this right now. It's important to note that over half of colorectal cancers are attributable to modifiable risk factors, so things you can change, right? Smoking status, unhealthy diets that are lower in fiber, higher alcohol consumption, physical inactivity, and obesity. Locally, strategies around increased colorectal screenings and linkages to care are already very full in effect. Our health department has already exceeded its annual goal of 45 screened through only 3/4 of the fiscal year. We've had 70 and counting at this point, and much higher than the 47 that we saw last fiscal year. And then concurrently, those that end up with a positive screen are being sustained through case management while they may await care. So we don't want to lose anybody to follow up as they await treatment.
This question,
Yeah.
also. You see commercials all the time now where there's like at-home kits and things like that. Does that reduce your number of screenings because you don't know about this?
No, so that is also part of our initiative is using Cologuard because there can be delay for specialty colonoscopy care. So those who have a low risk factor, we provide the Cologuard as a alternative option to make sure that we are meeting screening criteria and getting people screened throughout the community.
It's been a very important tool to get those numbers up, to get those to low to average risk, the ability to screen in a quicker turnaround time.
And I wasn't thinking either, but are those required, is like a prescription required for that? And would that make it easier to track? I don't know.
For us, we provide them through case management, but you can talk to your physician, and I believe you can even just go to the website and have them come in. We wouldn't get the results of individual screening. This is all based off of report, or we possibly could see an increase based off of CRISP integration if you do it through your physicians, because that information could be inputted into the electronic health record, which then goes into the state's health information exchange.
I wasn't, yeah.
Yeah.
Isn't there also advertised recently blood tests?
Yes, blood tests are another option for screening.
Yeah, and they get treated equally as the Cologuard, I guess?
Yeah, so that they would be referenced into the physician's EHR and then to the state's information exchange, and we would be able to pull those records through state data queries.
So while there are a lot of options, it is always best to speak with your provider because they are going to be able to assess that initial risk. Again, products like Cologuard work best for those of low to average risk. I am one that has a family history. I'm already talking, I'm not to that 45-year-old point yet, but I'm already in conversations with my provider about walking through that risk assessment, right? So especially because of some of the wait times to do that. So. But yes, a lot of options out there. Please still talk to your provider to start those conversations. All right, the next measure is our hemoglobin A1C control. Of course, poor control of A1C leads to severe complications, things such as vision loss, heart disease, kidney damage, and neuropathy. 2/3 of Maryland residents with diabetes had an A1C of 9 or higher during 2023. And statewide, our target for this is to reduce down to 60.3%. Good news for this one for Wicomico County, we are well within that target. In that same time period, well less than half of our diabetic residents in that age group, 43%, had poor control of A1C during that same time period. And that was actually the second best value that I saw in the state. So, however, as there's always room for improvement. I did take a look at if there were any disparities here. And while older age groups, 1 in 3 have an A1C above that value, when you actually splice out younger age groups, they are more likely, so 2 out of every 3, to have poor control in that 18 to 30 age group. So another area we could focus on in our outreach.
Is
this type 1 or type 2?
Both.
Both.
Yep. Combined.
Do we have a more type 1 or more type 2? What do you know the numbers?
The prevalence of each?
Yeah.
There's not really a good data source for that at this point. We do have self-reported diabetes in the state, and right now for our county, I think the last value is about 13% overall for adult residents.
I mean the difference between type 1.
Type 1 versus, no, I do not. I can definitely try to find out, though.
Sure.
Locally, chronic disease is an entire priority area for our CHIP. So we are continuing to expand diabetes prevention programs in multiple languages. We are one of the only areas to offer that in Haitian Creole, which is fantastic. We are also expanding those bidirectional electronic referrals. So again, the CRISP system that Matthew referenced, that we're getting more folks into diabetes education and management classes throughout the county. So for those that actually do end up with a diagnosis, there are classes and of course management opportunities. Oops, keep clicking this wrong thing. Okay. Next measure is our proportion of those hospitalized for mental health. Primary discharge diagnosis for any mental illness or intentional self-harm. Again, looking at those receiving follow-up within 7 days and or 30 days post-discharge. Follow-ups can be defined as telehealth visits, residential placements, outpatient visits with a behavioral health provider, and or partial hospitalizations, behavioral health hospitalizations. Good news is we are increasing these both at the state and county level over the past few years. In Wicomico, we're almost right at that target for the 30-day level. We are at 66.7%, and CMS wants us at 66.8%. A little bit of a gap, though, wider gap at that acute 7-day follow-up mark. Currently in the county, we're sitting at 36.5%, trying to get that closer to the 40.5% mark. Here we do see a distinct disparity by race and ethnicity in the county, though. Whereas 3 and 4 white non-Hispanic residents are receiving follow-up within 30 days, that percentage drops to a little over half for Hispanic and Black non-Hispanic residents here in the county. This measure was also included in our most recent Health Department Local Behavioral Health Authority strategic plan, so it is definitely under focus, and a possible area of expansion under the Rural Health Transformation Program, which we'll highlight in a few minutes. All-cause unplanned readmissions have improved in the state and the county the past few years. Of course, just as a reminder, it's kind of a fraction. The ratio above 1 means you have more observed readmissions compared to what you expected. Therefore, the state ratio is over 1, meeting 1.01 and meeting that definition. While Wicomico was below 1 in 2023, which is good, at 0.99, we're slightly above where the CMS would like to see us by 2036. We do see a much higher ratio statewide among Medicaid payer claims. That value was up to 1.04 in 2023. Locally, we see that the health hospital systems are focused on the clinical side of care, of course, for these avoidable readmissions. On the public health side of the house, we are always focused on preventing hospitalizations in the first place through improving care coordination for existing conditions as well as prevention programs in general. And then finally, food insecurity. This is kind of a worsening trend here in the state and county. Over 1 in 4 county residents reported food insecurity in 2023, so that was much higher than the state at 16% and above the CMS target of 15%. When we look at the most recent census data, Black non-Hispanic residents of our county were more likely to live below the poverty line compared to other county residents. And we all know at this point, income is only half of the story. We know the cost of living has risen for all residents in the past few years. So bearing those things in mind, we know that food insecurity is becoming, unfortunately, more of a reality for more people. A few local initiatives already in place. Tidal Health is working through their Food as Medicine program. This provides food insecure patients that have chronic conditions such as diabetes and hypertension some food options, healthy food options. Our REACH grant looked to increase healthy food options at the pantries existing in our area. And again, the Rural Health Transformation Program has food insecurity as a major pillar, which is what we will transition to now. The RHTP, or Rural Health Transformation Program, another population health initiative recently started here in Maryland. Overall, it's a federal $50 billion fund authorized by H.R. 1 last July to strengthen rural communities throughout the entire country. In December of 2025, Maryland was awarded $168 million of that federal funding, renewable over 5 years. 18 of Maryland's 24 jurisdictions are considered rural, including our county here, and this program focuses on 3 key areas or pillars of impact. One is to expand the existing and implement new efforts to develop, recruit, and retain a strong health workforce in rural communities, addressing multiple types of healthcare clinicians and allied health professionals. And so, earmarked kind of for the state in this program, programs could include the expansion of our area health education centers, which are our hubs for community health workers, expanding apprenticeship and training programs for allied health programs, and recruitment and retention of physicians and advanced practice professionals in rural communities. Pillar 2 is expanding existing and implementing new efforts to bring healthcare services into our rural areas. This includes, again, expansion of primary care services and trauma responses in rural areas, strengthening health information exchange, infrastructure, and connectivity. So again, those electronic referrals, how we identify those with needs and get them into the programs that they need, as well as support for regional integrated mobile health programs and the expansion of behavioral health services. And then finally, Pillar 3, as mentioned before, is a focus on empowering rural Marylanders to eat for health, increasing access to nutritious, locally grown, raised Maryland foods. So again, this will be done through nutritional education to improve food and physical activity, as well as establishing a rural food coordination program throughout the state. The anticipated focus in budget period 1 for this program for local health departments is really around Pillar 2, which is the promotion of access and innovative care, specifically mobile health expansion, bringing better healthcare services into our community. And so potentially one of the areas we would like to explore is an expansion of the county's Salisbury-Wicomico Integrated First Care Team, or SWIFT. This is a fantastic mobile health initiative between Tidal Health and Salisbury Fire Department that has an interdisciplinary team of a nurse practitioner, RN, paramedics, social workers, community health workers that meet people where they're at. I mean, literally house visits, right? So we're trying to hopefully reduce potentially unnecessary hospital encounters, especially for those low acuity needs among those in the community that may use the emergency department for things that could be potentially avoidable. Referrals for home visiting may include a physical exam, medication review, home safety checks, a social needs survey, health education, or simply to discuss the goals and ways residents can improve their health. Other connections to behavioral health services, primary care services, chronic disease management, and social services are also very important to this. Essentially, by treating the whole person and not just the condition, you're improving basic supports with the aim that the avoidable encounters should decrease. And then finally, not that we have a lack of things going on, but there is a third POP health initiative at the state at this time, the Maryland State Health Improvement Plan, or SHIP. And many times, at this meeting, we've presented on our CHIP, or Community Health Improvement Plan. So again, that is our an IRS requirement for the hospital system. It's an accreditation requirement for us at the health department. Same concept at the state level. This is the Building a Healthier Maryland initiative. trying to restart, sorry. And it has 5 priority areas: chronic disease, access to care, women's health, violence, and behavioral health. The good news is that the work here is already in progress locally. So anything you see highlighted in yellow is in alignment with our current local work plan, also through our local health improvement coalition. So we do kind of heavily align already with the state's plan. And so one of the requirements of SHIP was that the health department needed to pick one objective to create an action plan for. We decided breast cancer screening would be the objective we would like to move forward with. Statewide, the objective is to increase the number of eligible women receiving breast cancer screening to 82.2% by 2030. In 2024, only about 3/4 of eligible women received a screening here in Wicomico County, so we do have some room for growth there. We did select this particular objective due to the optimal timing of the Tidal Health mobile mammography van, and Wicomico County Health Department will be a permanent site for the van's rotation, in addition to any ad hoc community events where we'll be able to provide that service. Patients will also be screened for other social needs and those wraparound services and referrals, again, speaking to that whole person approach.
Wicomico also hosts our BCC program that does the 3 lower counties. So we are responsible for breast cervical cancer screening for the lower shore. So that is also a priority of this as well.
Finally, I did want to briefly touch on the latest youth risk behavior survey results in the county. These were very recently released, so a very high-level overview. Similar to the BRFIS, which is the 18 and older risk factor survey, the youth risk behavior survey looks at self-reported risk among Maryland middle and high school students, and is conducted every other year. There are 6 major areas of the YRBS, including alcohol and drug use, tobacco use, injury and violence, weight management and physical activity, sexual behaviors, and other state-added miscellaneous topics. Overall, there were much more improving statistics than those that seem static with no change or actually worsening. For substance use, we had less reported alcohol use at earlier ages for high schoolers, as well as less students reporting they were current alcohol and or binge drinking. Less middle and high school students also reported currently using marijuana, as well as ever using other illicit drugs, including specifically asking about heroin, methamphetamines, ecstasy, and cocaine. Middle and high schoolers in the county are also reporting less current and early age cigarette, cigar, and smokeless tobacco use. Specifically, cigarette use has seen a very dramatic decrease, so this is wonderful. In 2013, this same survey showed 18% of county high schoolers smoked. In 2024, that was down to 2.7%. So, of course, the next question is, well, what are they doing? So we do know that electronic vapor use or smoking devices, ESDs, are, of course, still popular. High schoolers are starting to show a little drop-off, though, in that use. Middle schoolers, this survey, no change so far. Of note here, we do see, though, that the enticement still seems to be flavored vape use versus traditional tobacco. So, again, in our outreach programs, we do focus on some of those topics. Injury and violence, this area does look at those key mental health metrics as well as other risk behaviors. All students reported they were less likely to ride with a driver who had been drinking or had been texting in this survey, which was good to hear. We're also starting to see a decline. Again, the key metrics for mental health, or they ask, your feelings about being sad or hopeless, contemplating and or planning intentional self-harm. We did see those creep up during the COVID era surveys, and now they are starting to come back down, which is a good sign. Under weight management, several more students are getting physically active at least 60 minutes a day for at least 5 days a week. Good to see. And less students are reporting that they are avoiding healthy eating things such as fruit and vegetables. We did not see any change in self-reported weight status. Oops. Several positive trends in the questions regarding sexual behaviors for county students. Less are reporting ever having intercourse, and among those that have, less are initiating at early ages, are currently active and/or reporting having more than one partner. Of note, though, among high schoolers that are active, 23% reported using alcohol or drugs, and only half reported using protective barriers such as a condom before their last encounter. So we're not really seeing any change in those metrics in terms of risk behaviors from previous years. And finally, a few miscellaneous questions this survey asks about. Again, with food insecurity, youth are, while adults are reporting more food insecurity, this survey tended to show youth were less likely to report that they were worried about their food supply or confirming food insecurity compared to years prior. Okay, with that note, I will.
You move me on?
Yeah.
Next slide. So our fiscal year 25 permit issued via in the MD turnaround times, we were compliant with all standards. So that was new construction permits were done within 3 days, repairs within 7 days, and well constructions within 3 days. And we had the third most permits in the state issued for wells for 25. Go ahead.
These were permits that were, I guess, maybe applicants that were turned in 25?
Yes, that's correct. So this is based off the MDE's turnaround times. We have to be within 80% of those times. That's what MDE is looking for. And as you can see, we were within those criterias for all three of the permitting types.
You had good compliance on the 25.
Yeah.
Probably still working on the 23, 24, which is the next slide, I guess, right?
Yeah. So our current fiscal year, we are below that standard for septic repair and well construction. We're currently sitting at 75 for repair and 70% for well construction. We were down 2 licensed environmental health specialists through quarter 1, 2, and now just hiring at the end of quarter 3 for trainees. So we should see an increase of that in quarter 4, and hopefully be closer to the 80% standard set by MDE. Overall, when you're looking at our permitting, we have 147 permit applications that we don't have complete information on, and we have completed 337 permits this fiscal year. Breakdown for that is we've issued 219 well constructions permits, 8 tank only, 63 replacement, and 70 new construction permits. On land evaluation side, we have completed 34 land evaluations. We do have 109 open applications. Unfortunately, this year we did not see a true wet season. But we did work with Maryland Department of the Environment for incorporation of an alternate testing for land evaluation, so what we can do outside of a wet season. So for that, we're doing backhoe test bits, and we are reaching out to landowners who meet the criteria or whose information that we have based off their soil profiles. and trying to get those processed. We have offered this to 24 properties. 10 have submitted their signed forms, and we have tested, we've scheduled 11, or we scheduled 7, and we've done testing on 4 of those so far. And these, some of these are subdivisions, so one may be where we're out on 5 plots of properties. Oh, cut out on me.
Mr. Connie?
Yes.
Just for clarity, I guess on the previous slide, you talked about the third most in the state for permits.
For well.
For well.
Yeah.
Is that, trying to follow up and understand here, I guess, and I see the other chart after that, but is this new construction or is this?
So that's just well construction permit.
And is that irrigation?
Yeah, it could be irrigation or it could be potable.
Okay. And then, yeah, I guess I'm trying to get a better understanding there is, are we, with, how about, I guess, septic system, where do we rank there as far as?
I would have to pull those numbers from MDE just for comparison's sake. I don't have that off the top of my head, so I apologize.
Would have been surprised if you did. But yeah, no, I guess what I'm trying to get an understanding is, are we?
Yeah, we are. Yes. So we do a lot of applications. We're probably up there across the state. We're on the higher end of permitting.
We are going into we are in our process now for updating our comprehensive plan for the county, and just making sure that we are still growing, closer to the prior funding area and not plowing over more farmland for more houses, or cutting down forest for more houses. So I don't know if you can get more clarity as far as, what the root of that is, or are we just in a situation where we know we're about 13 inches below or whatever it was for our irrigation, for our, so I don't know if that's
it fluctuates between I think 25 and 13 inches right now below the
as of yesterday. I think we were. So anyway, I don't know if that's an issue, but I guess I'd love to know in the future, are we still growing as a county with housing in the priority funding area? Are we starting to see more of that creep out? And then separately, just going forward, you don't have to answer this now, but just curious, is this as part of the drought? Is that what we're seeing for well construction? Is that a response to that, or is this more? We've also heard, we know that there's issues along Nanticoke and Bivalve and other areas with saltwater intrusion, and farmers having to go deeper for some of those wells. So trying to get clarity on that. You don't have to answer that now, but that'd be nice to know in the future.
As far as the well construction, I think it probably does have to do with the drought conditions, people being out of water. Saltwater intrusion, that hasn't been a major concern yet in the county. There may have been 1 or 2 wells that had that tested and reported, but there's not been widespread issues in regards to that. And then also, of course, irrigation wells, things of that nature. And then we've had some groundwater issues that have required new wells to be double cased and in a confining aquifer that have increased that over this past year.
And how many, I don't know if you do know this, but how many failing septics do we have in the county at this point in time?
At this point in time, are you talking about properties that are on holding tanks or that have submitted for a replacement system?
If you had to guess how many, we know that there's a lot of folks who have failing septic systems who just aren't reporting or not finding out until they go to sell their home. Do you have a rough estimate of how many septic systems? So
for replacement systems, we currently have, 177 open applications right now for a replacement system. And 114 of those, we're still waiting on information from the property owners.
Thank you.
Yeah.
Any questions from I guess when you say that about the success on permits issued and applications completed, It still seems to conflict with when you say that open initial site visits are not completed. And in 25, there's 25%, and 26, there's 50, about 55%. I get, that really confuses me on that, because that sounds like the application wasn't completed or the permit wasn't issued unless.
Are you talking about the land evaluation side of things?
Yes,
Yeah,
exactly. Isn't that part of the completion of the other processes?
So the initial site visit not completed, I believe that definition is if we've gone out there and, sorry, I just lost my train.
So on this report, there are 102 total applications for land evaluations where an initial site visit has not been documented as completed. So as you scroll down, the 54 and over half are ones that were received this fiscal year. So so it moves backwards that way. But yes, there are 31% of all the applications are.
And what's considered a completed, initial site visit completed is that we've done piezometer readings, we've done auger holes, we've assessed the soil profile. So that is when a completed site visit, initial site visit is done. So we may have done that work, but we haven't done a piezometer reading or evaluated the water table, so they have not been completed yet. Once that is all completed, that's when they move over to the open initial site visit completed, and we're waiting on a design, or we're waiting for a season where a sand mound system could be installed. So it's just, it's not to say we haven't started the work, we just haven't finished the work needed to issue a permit.
Yeah, so let's just say you visit a site and you determine it's not any good for new septic or something. Now, if the homeowner believes otherwise, is the homeowner able to get a hold of the documentation that was taken to determine on their own whether or not the job was done correctly or incorrectly? And if so, could they take that to a higher power to maybe get a second opinion instead of going at the word of one man?
Yeah, so there's an appeals process, and that is given for any time we've determined a final decision. We provide those appeal rights, and we do provide any documentation that we have for the complete file.
Okay. All right. Thank you.
Yeah.
Questions? I've got one. Yes, Joe.
So, in the past, you all design or approve the design of the systems correctly. Do you design any of the systems yourself?
No,
they have to do the design, engineer it, then they bring it to you, and you approve it to be a working model that will.
Yes, if it meets the minimum specifications required for the work done.
Who's responsible, and I've asked this question before, and I guess I'll get the same answer. Who's responsible if that system fails per your review and approval of design?
There's a lot of different conditions that may affect a system. Do they have a leaky toilet? Are they running a lot of laundry? You could overload the system, and that could cause a premature failure. So it really is based on probably the design and the installer. They may have a warranty for the system, but it's not a finite science to establish the length of life or necessarily what may have caused a premature failure of the system.
So the health department wouldn't be responsible?
We would not be responsible for that liability.
That's the answer I got the last time I asked.
Yeah.
So.
Any other questions? Thank you very much. We appreciate you taking the time. Entertain a motion from council to adjourn. Hang on a second. Sorry. Entertain a motion from council to adjourn from the local Board of Health and reconvene in legislative session. Second. Favor? All those in favor?
Aye.
We're now reconvening as Wicomico County Council for the legislative session 2026-10 for May 19th, 2026. Ms. Chattel, good afternoon, good evening, good morning. One of them, take it.
Good morning, Council President Cannon and Wicomico County Council. I'm the Internal Auditor, Anjali Chattel. I would like to present Resolution 76-2026, acknowledging the Roads Division audit, fuel, DEF, and other roads inventory.
Entertain a motion from council to approve Resolution 76, 2026.
So moved.
Second?
Second.
Discussion. Thank you.
The Office of the Internal Auditor performed an audit of fuel, DEF, and other inventory at the Wicomico County Roads Division. The objectives were to evaluate the controls designed to manage risks related to compliance with policies, safeguarding assets, reporting accurate and reliable information, and then, of course, to make recommendations if appropriate. I concluded that the program design was satisfactory, and I had 3 findings related to first, inventories and reconciliations, which was partly remediated, required elements on logs and at entry point of sale, taxed and non-taxed diesel fuel. In addition, there's a section on the status of prior findings. One of them was replaced regarding the logs, replaced as one of the recommendations in this report. And then the 3 other recommendations from the last audit could be closed out. And management did provide a response.
Any questions from anyone? All those in favor of Resolution 76, 2026, say aye.
Aye.
Opposed? Motion is carried. Resolution passes unanimously.
Okay, for the next one, Resolution 77-2026, acknowledging the report on gift cards. This was a review of the gift cards of Wicomico County. The focus of this exercise was to review support documents and summarize the processes and details for P-card transactions for gift card purchases and high-risk transactions.
Entertain a motion of council to approve Resolution 77, 2026. Second. Discussion. Thank you.
In the report, there's information, there's tables on gift card transactions. There's a section on promotional gift cards, high-risk transactions and donations. And then there's a section on periods for which support documentation was not provided. And then there's appendices with state policies related to LMB, as well as some Rec and Park policy and Rec and Park template.
Okay, we've had a lot of questions about this in the past few weeks, months, whatever. It is in the brief book, and I think people would be kind of surprised to look at it and see what's been handed out. I mean, we're not talking about a few $100s. We're talking about thousands and thousands of dollars in gift cards being passed out in the past couple of years, correct?
Yes.
Has the policies been followed as far as following up on the gift cards, as far as who they go to, the paperwork filled out?
So there didn't seem to be a policy for gift cards at the county level, and then there are state policies, however. There could be some potential questions there because this wasn't an audit. I didn't really do like testing to see, to do fails and counts and so forth, and then to then ask management for follow-up. I have heard it several times throughout the review that there's state policies or state auditors review like LMB, if you're talking about the LMB gift cards.
Well, any gift cards that's, handed out to anybody, have they followed the procedures that who's getting the gift cards, who's using them, and all that? Are they filling out all the paperwork properly that they need to?
I didn't see a policy specifically on gift cards in the purchasing manual.
Rec and Parks has got a policy.
They do.
Yeah.
They do, and that's in there. one thing with the rec and park policy, it is dated April 1st, 2025. My scope period was largely prior to that. So it's not something that I could have, even if I was going to look at for testing, it wasn't effective like during prior fiscal years, except for a small portion of.
So they set the policy
25.
during the time that you were doing the review?
That's the updated policies dated that. I think they sent me a document prior to that that wasn't dated, so I wasn't quite sure what the effective period was for that.
So what is the protection to keep people that are getting these gift cards from using them for things they shouldn't be buying? I know that LMB said at our last meeting that, you know, they were buying it from one grocery store because they had the protection of not being able to buy alcohol or tobacco. And I've asked for that documentation, and we've not received it yet because the executive's office says a lot of it's just verbal. They can't provide the information, or they can't provide it readily, I should say that. To get past that, what is the protection to keep people from using these gift cards for tender to sell them to somebody else for lesser value? Is there any protection there? In other words, if somebody gives somebody a $20 gift card, what protects that person from selling that gift card to somebody for $10, say, to buy?
I'm not aware of any control for that.
Mm-hmm.
So there could be one. I'm just not aware of one.
Okay.
I got a picture from of the Food Line gift cards, and on the Food Line gift card it says not to be used to purchase alcohol or tobacco.
I think Ms. Keene showed us at the last meeting.
Yeah,
Yeah. Okay.
it's on the gift card. For Food Line.
Can I see that picture?
Yeah, I'll show it to you. I'm sorry.
That's fine. It was supposed to be sent to me, but sorry for the holdup, Joe.
No, it's okay. It's right there.
Yeah.
Right there.
Just to clarify, the receipts that I looked at didn't actually indicate that it was somehow a special gift card compared to any other gift card. So I don't know when a specific card was purchased in comparison to the receipts that I looked at, but the receipts don't indicate that they're somehow restrictive. And then one other comment, there were receipt transactions that were returns of gift cards, and that I did see, so.
So we had a letter from the county executive's office that stated they were supposed to be, these gift cards were supposed to only be used for food, correct? And that was in the response letter. And I suppose, I know what Southbound Alley is. Okay, that's a bowling alley, correct? Is Regal Cinemas, where they've been buying gift cards for Regal Cinemas?
There are some transactions for Regal, for a cinema.
Okay.
I can find it on here if you'd like me to, but there was a cinema in here as well.
Yeah, that's fine.
I have a question.
Yes.
L&B, Food Line. And I'm looking at 2 days where they spent $980 twice. My thinking is, I'm trying to be positive, is that when they get grants, because they say program supplies, so if they get grants and the people turn in the receipts, would that be part of Food Line?
No, the purchasing them in like $900 intervals, I believe it was so that they were purchasing them for different months, like that they didn't want to have. I think, like, you know, if they're going to be giving out gift cards in December, they maybe would buy them in January. If they're purchasing them in October, they would maybe buy them in September or something like that. Maybe at the beginning of the month or at the end of the prior month.
They did two in the same day.
Yeah.
They had two of, I'm just an example,
Yeah.
$980, and then the begin. So when they do this, where does the money go? Where does the gift cards go?
Yeah, so One other thing about the two purchases, sometimes I believe they said something about how the store wouldn't allow, and I could be misphrasing this and I apologize, but something about how they couldn't purchase all of the gift cards that they needed in one transaction, and it was a store's requirement that it be split into multiple transactions, something like that, to get all of the gift cards in one purchase.
What are they doing with these gift cards?
They were putting them in food boxes for distributions.
People that can't afford to eat.
So
there's a section on page 18 of the report that talks about how the forms were used to request food boxes, and so there's more in the box than just the gift card, and I don't know what else. I think the LMB's come to the table before and talked about the food boxes and everything else in it, and there's also in the back an exhibit from the LMB budget. I took a screenshot, I believe. It's a... I can get you the details of what all is in the gift boxes. I think it's in the report, but I can't find it readily. But it included other things in the budget for what was in the boxes. Did that clarify? Let me get an email to you about what's in the boxes.
I just have a problem. You know, we have pantries. Are they giving the food to pantries? What are they doing?
Yeah, so there were two different situations where the food boxes were being distributed. In one, they were being distributed to schools, specific schools. I reviewed a lot of binders for different schools, and not every school was getting a box in every single month, but different months had different schools, and there were certain people at each school that were getting a box. That was in one situation. The other situation was where the boxes were at LMB and then people could walk in and then obtain a box. And so they had different forms for the different situations usually. One version where the forms were being filled out when they were coming in.
Acting like a pantry.
I don't think that they use the phrase pantry, so
if they're giving away food, I don't want to dwell on this, but if they're giving away food, that's, to me, is a pantry if they're coming into the LNB office to pick up a box of food. My concern was, and things could change, if you're purchasing food from a program that's being funded through LNB, I was thinking maybe that's the receipts they were getting for where they purchased food, and maybe Food Line would be the place that they would recommend to buy food for programs or whatever they're doing. But this keeps popping up, $980. And you don't have no documentation in here, just a figure.
I did look at those receipts. So I looked at every... maybe there could have been a receipt that I didn't see, but for the most part, I did look at a lot of 900 and I think it was 980 or 99, whatever that high amount.
Stuck out in my mind,
yeah.
I saw that 900.
I looked at all of, I believe I looked at almost all those receipts, and that my understanding was that if they tried to purchase $3,000 of gift cards, something about the way the system, because it's every single gift card, and just the system couldn't handle it, so that's why it had to be chunked up like that into splits, even though they were all in the same day. So I would look at multiple transactions in the same day for gift cards at the same store. And then going back to Councilmember Holloway's question, it was Regal. You were
okay.
Yeah.
Now, those gift cards, for whatever reason, LMB requested from the county attorney, I guess that's Mr. Wilbur's office, that the names of the recipients of those gift cards be redacted so nobody would know who got them. Why would that be?
The redaction request didn't specifically say for me to, if it's not in here.
It's on that list you put up there.
The exact legal reason, like if it was a specific PIA law, what the law reference was. If it's, I believe it wasn't actually listed as what the PIA law requirement was, but they did make their case, and the county attorney did agree to that redaction.
I understand that a lot of the gift cards that went, like, we've been using business names here, and I was kind of trying to get away from that to begin with, but I know we haven't used names of who's gotten these gift cards. I understand, and that's fine. But I really find it concerning when, and as an internal auditor, I think you should too, that when it comes to gift cards that aren't used, well, South Baton Alley has snack bar. I'm sure I know Wriggle Cinema does. So I guess they could say, well, they used them there, but why redact those? I think that would have been a real good question for the internal auditor to get an answer from the attorneys.
There were reasons that I saw in those emails, but it wasn't said to say in here under 18 or food insecure. So I don't want to misphrase what the county attorney said for stating what to state as the redaction, that food insecure, underage, didn't give permission, something like that.
Okay, can you go to page 29?
Yes.
Your pages are numbered the same as what's on there.
They are. Yep.
Explain the two charts, one for 49,000 and then one for 1,265,000.
1,265,000 for all transactions for the period, for the units that that I reviewed,
Okay, so
that had gift cards.
You're talking about $1.2 million in gift cards.
No. That's just the net of all transactions for all of the periods in which I found gift cards. So the gift card total was 49,000.
Okay.
Yeah.
All right.
Yeah, it was just the gift cards was 49,000.
Not that that's any better, but anyway. So we've questioned this with LMB, and they defended it strongly in the past year, that they were doing things right. Well, when they came in the last meeting and we brought it up, they suddenly announced they were discontinuing using gift cards. Does that create any suspicion? It does for me. It creates suspicion that maybe something wasn't right to begin with. I mean, if they said before, they said they were following all the protocols, everything was what they were supposed to be doing. I find it real interesting that they only bought gift cards from one food line. They didn't, they had to special order those gift cards, but there's other grocery stores you don't have to special order gift cards from, that you can get them that's restricted.
Yeah, and
alcohol or tobacco.
We had this discussion as well about the purchasing manual. It wasn't something I was thinking about during the review because it was more of a report, find and report rather than a testing. But, the purchasing manual does have a threshold at which there's supposed to be some written quotes, 3 written quotes if the threshold is between $10,000 and $24,999. But it wasn't something that I tested as part of the review to get management response as to why the purchasing manual shouldn't apply.
So I'm sure people are wondering what, all the concerns about this. The state of Maryland basically outlawed giving away gift cards a few years ago, but they also gave LMB the leverage to use gift cards if they followed a strict policy. So did LMB follow that strict policy?
In my viewings, I saw some inconsistencies that I would have questioned, and if this had been an audit, I would have had some questions that would have been brought to management to then determine if my testing had indicated fails and findings. There would have been some lines that would have raised some concerns. And then the other point was that to truly know if this was not in compliance with state law, maybe a state auditor should be the one to make that decision, or a state investigator of some sort.
So would it be your recommendation that the council send your findings to the state auditor, the Attorney General's office, or, now I know they won't do county items, but they will do what the state, like LMB. So would it be your recommendation that the council send your review to the state auditor to see if they would like to review the past practices of LMB? Well, they won't review what the county's doing, so.
It could provide some clarification to council. I think they're having concerns, and so and then we've heard responses from the other side. So having clarification from potentially a neutral and more authoritative source for their rules from the state could potentially help clarify if the county is doing things correctly or how to improve that going forward to be in compliance with state law.
Okay, so we've been talking mainly about LMB, but Rec and Parks, there were a number of items there, and of course we had the reasons why, but I find that the excuse was they had to feed the folks that they were under contract to. We understand that, okay. But there are restaurants open in the area that are open late, don't serve alcohol. And it kind of raises your suspicion or your, I don't know, what do you want to call it, when you see $225 in gift cards given to the Rock Creek Christian Academy to burnish beer. I mean, that does kind of make it look, and then you have other high schools getting to brew pubs, $100 to Crabs to Go. I seen Bobby just shook his head over there. But, those kind of things, you're talking about taxpayer dollars. Now, I know LMB works off grants, and the Rec and Parks, they get money for people entering the contest and whatsoever. But when all that comes into the county, it's taxpayers' dollars. So thank you for your review.
Just to clarify, did you want me to ask the Attorney General's office, and do we need to have a consensus on that?
I think that's something the council needs to discuss, right,
Okay.
John?
I mean, I don't think it's something the council would have to approve that. If you think that would be necessary as part of your responsibility, that's fine. I mean, you're not filing a formal inquiry. You're just asking for more information. Am I correct?
If they, I guess asking if they want more information, if they think that it's okay as is, if we need guidance from them, yeah.
For clarity, that's with regard to the LMB and the grant, the state grant that was
Correct, just for
not
LMB.
county
They
tax.
wouldn't deal with the county, the Rec and Parks.
I just see something here. It tickles me. If I went to Classic Cakes, I don't think I'd be purchasing cake or cupcakes or something. And they got it, the account name is Office Supplies. To me, I mean, it should be better characterized to me, Classic Cakes is not office supplies. $500 to another restaurant, it didn't show what was purchased, so how do you know they didn't buy alcohol? See, those kind of things, you should have an itemized receipt. And here's another one, another Classic Cakes. Here's Brew River, oh, Lord, forgive me for calling the name, but $500. A receipt was provided but did not show what was purchased. So you're talking about alcohol. How do we know alcohol wasn't served? If they don't have it listed, what they purchased.
Mm-hmm. Yes, and
that bothers me, because detailed information, like Joe said, is taxpayers' money. And when you see these kind of purchases and LMB, and I was one of the first board members of LMB years ago. If it was, say, we're providing food for one of the outreach ministries or something, and we gave them $980 gift card to buy boxes of food, just showing $980. That makes me suspicious. I hate to say it, but that's what it does for me.
Mhm. Yeah. And just to clarify on these high-risk items, the Brew River and Mad Hatter, there were gift cards in here as well already for those vendors. For Sam's, it was a slightly different vendor name, but it was still Sam's, and I reached out to Sam's to get clarification on if that somehow meant that it was not a gift card, and they said that you couldn't actually tell by the vendor name, and you really needed to see the receipt. And then for Classic Cakes, I did actually call the vendor, and I did speak to them, and they do actually give gift cards. They couldn't clarify or confirm that any of these were or not gift cards or anything like that, but that vendor does actually sell gift cards too.
So, thank you for your report. Just to give a little more oversight, $250 in gift cards to Bergen Catholic, $250 gift cards to the Moutheth Catholic High School, $200 in gift cards to Dream City Christian, $250 in gift cards to Martin County High School from the Green Turtle. So the kids are having a ball. Thank you.
Councilmember Merritt, I think you were going to say something earlier.
Yeah, I think my question got answered
Okay.
through the discussion. Multiple transactions on the same day. I'll use April 4th, 2020 on page 13. $980 3 times in the same day. Just wondering if each transaction was one gift card or was it multiple gift cards in that 980? Was there a breakdown? Or?
Yeah, it was multiple gift cards
Okay.
for 980. So in
That's $3,000 in one day.
Call that invoice splitting, John, Dave.
Yeah.
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 I didn't actually use the word splitting during the review because I wasn't in that audit mindset. But on page 17 and 18 of the report, where I talk about to whom gift cards were given, I note for fiscal year 2024, the gift card amounts were $10 each that were to Food Line. So even if the report said 980 or the receipt said 980 or 990, those were all $10 gift cards on that receipt. And then, and so if there were 3 transactions for that amount, it was 3 receipts for, 98 or 99 gift cards on each receipt for $10.
So on that particular day, they spent $3,000. That's $310 gift cards, right?
Yeah, if they spent $3,000, it would have been 300 gift cards that day in fiscal year 24. Yes.
Thank you.
Yes.
And I was a bit confused also on some of the high-risk transactions you reference, but you really don't draw a conclusion as to what management said was the problem or what they might have said was a resolution. And I understand that receipts were provided, which is, I think, a good demonstration of good faith, but there was not any description of what was purchased. What I found very unusual was the fact that the amounts, such as Brew River or Mad Hatter, were exactly 500. So it's not as if that could have possibly been, a meal or, a meeting at either one of those places. But you don't say in the follow-up what the determination might have been as to what that specifically was. Is that purchasing a gift card, you think, or purchasing a gift certificate?
Yeah, so I never got a definitive answer for those. And just to clarify, there were other transactions where the detail maybe wasn't on a printed receipt, but management provided an assertion that it was for food. So there could have been another, whatever restaurant for $500, and then they said that it was for a banquet. There are some departments or units that do make large flat transaction amounts at restaurants to cater an event. So it is possible that it could have been for a catering event or something like food plus tip plus delivery or something else.
Which makes sense, but
Yeah.
what's really complicated here is that there are a lot of determinations on what occurred, but, we're approving this resolution as in, to, I guess, codify the work done. But I don't see where there's any resolution to how we're resolving the problem. I know with local management board, they stated they're no longer going to be using gift cards. But there's nothing in here that really gives us finite determination that there will no longer be, these practices will not continue. So where does that leave us?
So the council could potentially, with county or council attorney assistance, draft legislation in some sort of way that regulates gift cards. There are other jurisdictions that have rules or banning of gift cards. I did put in the report situations where the county was receiving gift cards even though they weren't explicitly purchasing it, partly so that you are aware that that occurs. So if you do create legislation on gift cards, that you consider that sometimes a gift card may be a free option as part of purchase, or even situations where it's not even an option, it's just basically given to the county regardless. So that's why I also did put some of those in there, so you're aware of the full impact of where I saw gift cards.
I don't even know if giving donations is always appropriate. I don't even know if that's appropriate at all to give donations.
It's the decision, it's a good question, John. You're taking taxpayer dollars, but one person in the county is making a decision to make a donation to an organization, when the other 100,000 people in the county might want to make a donation out of their taxpayer dollars.
At this table might want to make a donation to somebody. I go to the events all the time.
Yeah. So.
Any further questions on this?
Back to what Joe said with the Attorney General's office. What exactly were you suggesting?
I would suggest if she would possibly, what are you going to do? Just send a letter asking them to review your findings, or?
I guess I could ask if they want to review the findings, or they're not findings, but if they would like to. Okay. Okay.
Not asking anything.
Okay.
Yeah. Just tell them we think we have a problem.
Does that rise to the level of a formal complaint, Mr. Benson? When you inquire with the Attorney General, does that rise to the level of a formal complaint?
I mean, I assume it would be interpreted that way, because I don't think they're going to do an investigation if you're not making a complaint.
I didn't know. At first, I thought you were suggesting just for clarification on some issues.
Right. So either we could request clarification or submit a complaint, which.
Just say if you did a review and you have there's serious questions about how the operation was running, and if they would audit it.
I think before we could make that decision and the council could make that decision, I think it would have to be a little more clarity as far as which specific violations, or how you might choose, or what you may decide need further review.
Well,
I don't want to send it across the board.
They won't do anything but the state grants. They won't do anything they won't do rec and parks. They'll only do LMD. Correct?
I believe so. I could draft something up for a work session.
That'd be great.
Okay. Yep.
I just say going forward, I first of all, I want to acknowledge that your position as it exists for internal auditor obviously came about after that debacle of the fuel system, and so having the previous report, I think, is helpful. And also, gift cards are, as we are all acknowledging, one of these areas that need a lot of sunlight to make sure that it's that things are going right and going well. So I don't know if that's something maybe more in the future that the council could look at for legislation. We'd have to be very targeted for that. But overall, I think what hopefully that's the bigger issue. You just providing more attention and on this it shows how much that this is an issue that clearly needs that could be ripe with problems. So I don't know if there's a way that we can help the county work with the departments to still do what they want to do in a way that makes sense, but also to then further mitigate that risk. But just the fact that you're looking over it is really a positive thing in general. So I just thank you for that.
Aren't they calling that waste, fraud, and abuse national?
Yeah, we got to, and I think that's a positive. The more the folks that are in their position like yours, the more that we root out waste, fraud, and abuse, the more that people can believe in democracy, believe in government, and that's ultimately what we want. We want things to be done right and well. So I appreciate you taking the time to look at it.
Questions, comments?
I would just support looking at legislation or other jurisdictions and perhaps a work session later on to encompass this whole issue so that we're not piecemealing and asking all these questions and put something in place that's going to work for us, down the road. I think it's worthwhile to pursue that.
I did find other jurisdictions that did have legislation. As part of the work session, do you want me to include some copies from those other jurisdictions?
Yes.
Okay.
Any questions? All those in favor of Resolution 77, 2026, say aye.
Aye.
Opposed? Motion is carried. Resolution passes. Thank you very much, Mr. Chatel.
Thank you.
This time, we open the floor for public comments. If you have any comments you'd like to make, come to the podium, please. State your name, your residence, and your concerns.
Jim Atkins, Wicomico County. I want to talk about the audit that was just discussed.
Tim, can you pull your microphone? The older fellow on the end don't hear it.
You having a hard time?
Yeah.
I can talk louder, believe me. I want to mainly talk about the audit for the fuel, the DEP, and the diesel. I guess, what do we, President Cannon, Councilman Holloway, 16, 18 years from the fuel debacle at the landfill. And we were supposed to put all these audits in because we had this problem. This is the executive's management view response to the audit. It should be noted the audit was conducted without the internal auditor consulting the Department of Finance. This materially impacts the financial statements of the county. The failure of the internal auditor to bring in the Department of Finance impairs the ability to give a full and complete view to the auditor and the council. The primary objective of an internal auditor is to encourage an entity to make changes to address identified weaknesses. Lack of communication with the finance department was one of the executive's main problems with this audit. The people who have looked at the brief book and the council members and our auditor, Ms. Chantel, who has done an excellent job on this. There are 3 pages of emails of response that she had with the finance department. So how can the executive and the finance department say that they weren't consulted, weren't spoken to, and weren't involved in this? This young lady's got 3 pages of emails, dates and times that they were sent, and whether or not she got responses. Take this back to Safari at the quarry. She couldn't do an audit because they wouldn't give her information. She can't do an audit now because they won't give her information. Why do we not have controls in place? An audit is to be performed to find out if you have a problem and fix that problem, not to send out a response that blames new hires, lack of communication, and all the other things that the executive wants to blame it on, other than the fact that this administration does not have controls over what's going on in this county. They don't have controls over the money being spent. And it's real simple. You put controls in place, the auditor goes in there and she does the audit, and she comes in here and tells you somebody's either stealing or everything's good. But we've got so much cloudiness in this administration with the auditor that this lady can't do her job. And you really need to back her up, because it's not going to get any better until somebody demands the fact that you have accurate information. You don't know right now whether fuel's being stolen from the landfill or not, again, because the controls are not in place that should have been put in place 16 or 18 years ago. Or they're not being followed because, according to the executive, we have new employees. You know, it gets old after a while. For the first year, the executive would come in here and say, well, I'm new at this. It's my first year. Well, it's your fourth year now. We ought to have controls in place. Thank you.
Thank you, Mr. Atkins.
Good morning, almost afternoon. Mikkel Darlene, Wicomico County. I'm sure that most of you know that I am here today about the open work session you guys are going to have on Connolly Mill Park soon. I'm representing Save Connolly Mill Park. We have quite a few advocates in the room that are really, really excited to be here today. If anybody that is in favor of this land conversion that's going to be discussed can, stand up, put your hands up. Let's see everybody here. See this room? It's been a long and windy path. This place is really important to Wicomico County. Director Steve Miller, I can't say enough good things about everything you've done and about the work that you've put forth for this county. We are blessed to have him, and the plan that he has here for us that he's going to present today really has the opportunity to be transformative for Wicomico County. We have the potential. Today, we had a resolution. We talked about mental health awareness for children. I was a sexual assault, domestic violence advocate for years. Almost all of the work that we did was way more effective in green space. We had a presentation from our county health department, and we talked about the need for good public health outcomes, mental health help. All of these things happen when we're outside, when we're in nature. We have several local organizations that do ecotherapy camps. We have eco-stewardship initiatives. We have people that care about our environment. We have people that care about our youth. And what's really unique about Connolly Mill is that's within 5 miles of the downtown urban zone. This allows equity of access to green space for people that don't have it. A lot of the people that need it the most can't drive 35 minutes to Pirates Wharf, which is amazing. That's another great county resource. But this here provides it to people who need it the most in a way that they can reach it. It also really speaks to being fiscally conservative with our money. Developing Connolly Mill will take the least amount of capital investment and at the same time will provide the most amount of positive economic driving. We don't need a lot of money. We don't need a lot of infrastructure, but we have bird watching groups. We have running groups. We have biking groups. We have so many different civic organizations that can make use of this amazing place and bring money into Wicomico County while also improving the physical and mental well-being and just bringing us together. This is possibly transformative for our entire generation. And we have this power in our hands, and I really appreciate that we're here in this moment, and I appreciate James Wynn for holding the town hall. I appreciate Steve Miller for bringing this forth, and thank you, guys.
Thank you.
Good morning. My name is Rhonda Tomko. I'm from Wicomico County. And just to quickly address the discussion that we just had, or witnessed, I guess, on gift cards, it's apparent that the council is striving for a higher level of integrity and accountability and to strictly avoid the appearance of misappropriation, whether there was any or not. As one who strives and has raised other human beings to live above reproach, I want to say thank you for that demonstration and the discussion that we just had. As a continuation of that discussion, I'm here to support the proposed land conversion for Connolly Mill. This decision represents something larger than just a parcel of land. It's about honoring gifts and our commitments, protecting our limited and treasured natural resources, and investing responsibly in the legacy of Wicomico County. My husband and I moved here 5 years ago specifically by choice for what Wicomico County offers. this rural agricultural environment that's both developing and beautifully natural all at the same time. And some of you may know me from being involved with the biorefinery project. I'm a neighbor to that project out on Hickory Mill. So supporting this conversion protects the original vision and promises that were made when Connolly Mill was gifted to us. We all know in today's culture how much public trust matters. When land is given with the understanding that it will serve the community as protected parkland, we should do everything possible to preserve that intent for future generations because we are a people with integrity. Second, the public has spoken clearly through recent Wicomico Park survey, which showed an overwhelming citizen support for Connolly Mill. We've consistently identified the need for more accessible green space for outdoor recreation and environmental preservation. This proposal reflects the priorities of the community, and in addition, our Rec and Parks Commission also reached a consensus vote to support this conversion during their March meeting. Finally, I'd like to address the significance of our environmental stewardship of Connolly Mill. This land sits within the watershed of Wicomico River and plays a role in protecting our drinking water and our natural ecosystems. This is a significant issue as you all work to balance our growth and development with the preservation of our unique beauty and environmental health. When we preserve our open green space, it helps reduce runoff, it improves our water quality, it protects wildlife habitat, and it strengthens the resilience for future generations, which I'm raising here. Once environmentally sensitive land is lost, we know that it's likely impossible to regain and restore it. And so, many of us residents know that the park has the potential to become a defining public space for Salisbury and our county. And so I respectfully encourage you to support this conversion project. Thank you.
Good morning, Mike Goldberg, Wicomico. Open spaces and parklands are particularly important to a population such as we have in Wicomico County. Here, we are outdoorsmen. We are farmers, watermen, hunters, fishermen, hikers, bikers, boathers, and bird watchers, etc. The POS conversion to the Connolly Mill site in its entirety, including its unique water resources created by the existing sand pits, will create unparalleled outdoor recreational opportunities for the people of Wicomico County and Salisbury that will be available to everyone, not just to a limited few. Parkland, such as that which we hope will be created at Connolly Mill, will contribute to improving public health and the creation of a quality of life which will attract employers and new residents to help expand our local economy. Many people across the county have dedicated themselves to making Connolly Mill Park a reality, and to them we owe our thanks. It is my hope that a park at Connolly Mill can be brought to fruition. By doing so, this council, the executive, and the director of Parks and Recreation, among others, will be leaving behind a legacy of which they can be proud. The conversion has broad public support, and it is simply the right thing to do. It is therefore my hope that y'all can get this done. Thank you.
Hello, Lana Foley, county and city resident. For generations, places like Connolly Mill have quietly held the memory of our land. Long before roads and subdivisions, our land was a landscape of towering trees, cool shade, rich soil, and living forest. Today, so little of that remains. That is why protecting and cherishing spaces like Connolly Mill matter so deeply. Local author and forest advocate Joan Maloof reminds us that when we lose forests, we lose far more than scenery. We lose living systems we barely understand. She writes about stepping into one of the last remnants of old-growth forest and immediately noticing something that's forgotten, and that's the air itself. The sweet, rich, earthy air created through the relationship between trees, fungi, insects, soil, and water over generations. Scientists now recognize what many people already feel, that forests heal us. Time among mature trees lowers stress, improves health, and reconnects us to something older and steadier than ourselves. The Japanese even have a practice called forest bathing, which is backed by research for lowering stress, reducing blood pressure, and boosting immunity. Conley Mills should move forward to becoming a cherished park and community space because once these mature landscapes are lost, they cannot simply be recreated in our lifetimes. A newly planted tree is valuable, but it cannot replace the ecological wisdom stored in older forests, older soils, and intact natural spaces. Beyond conservation, we should want a place beyond an open field playground. It is about giving children a place where they can smell the forest after the rain, hear birds instead of traffic, and walk beneath large trees and experience wonder close to home. We have so few opportunities left to protect places that still carry the spirit of the land before us. Conley Mill can become not just preserved land, but beloved land, a place for community gathering, quiet reflection, education, and healing. We fight for farmland against solar panels. Why would we do anything different for this land, water, and ecosystem? I urge you to support the vision of Conley Mill as a cherished park and community space for the generations who deserve to inherit more than pavement and memory.
Thank you.
Good morning, Council. My name is Monica Brooks. I'm resident of Wicomico County and City of Salisbury, also president of Wicomico County NAACP. I came for a particular thing, but I did want to make a comment about the audit. That issue is something that was brought up a long time ago. It's still unresolved, but I want to say to the council, the auditor asked you to give her license to do certain things, and then you threw it back to her. I think it's the council that should instruct her to give her the assistance that she needs to be able to do her job more diligently, as it was addressed that her information that she's requested, that she has not received that support. So I think the council should back her up in the way that you're able to do, so that we can get some real answers, because we should not have this stuff hanging out for all this time. It's kind of ridiculous at this point. I wanted to bring up a matter regarding mental health. I'm glad we talked about mental health this morning. I did want to acknowledge that in addition to the ongoing mental health issues and crisis, the students that are seeing their friends and family and being taken by ICE, children that are missing this year, I think almost 190 students that are gone from the school this year. We just want to make sure that those students are actually in a safe place, that they have not been trafficked. We'd like to request for the, whether that's through the health department, to verify where those kids are, that they are safe, that the reasons for their leaving, whether their families were deported or whatever the case may be, but for a verification of the mental health of those, the verification of the location of those children, but also prioritizing the mental health that these kids are dealing with, seeing their friends and families being taken. Lastly, I want to, one of my first purpose in coming here, but so in order to address widespread complaints throughout the county from various employees that have dedicated many, many years of service to working for the county, there are severe salary compression. And what that means is that you have employees who've been working years and years and years and years for the county. New people are hired at higher rates than the people who've been working here for many years, people who are working in supervisory positions. So I wanted to offer a remedy, something from the county, and I don't know if this is considered just policy that has to go through the executive, or if there's something that the council can do to create a policy for independent third-party salary and structure study. So what that does is that allows for someone on the outside, take away emotions, connections, cronyism, all of that sort of thing, to look at the best way to ensure that everyone is paid what they should be paid, and that people are not hooking each other up because of who they know and what that sort of thing, and that everyone gets a fair wage and what they should be getting, as opposed to somebody who has all of this knowledge getting the same pay as someone who gets hired that knows nothing. And that's what we're dealing with currently. I think you should investigate it.
Bruce Robson, Wicomico County. I support the process continuing on Connolly Mill. I don't have anything to add other than the eloquence we've already heard. I also wanted to thank both the administration and the council for support over the last few years regarding, I'm a part of a group called Wicomico Clean that volunteers working on litter in the roads, and the job description of the position in this budget is maybe not perfect, but it's pretty good. It's pretty darn good. And we really appreciate that and hope that that remains in the budget. Yeah. Thank you all for your work. Much appreciated. Yeah.
Yes, hi. Joe Diggs, Wicomico County. I'm not going to repeat everything that was already said because Rhonda took my whole little spiel I was going to say. But anyway, I'm here to ask your support for the conversion program, open space over to Conley Mill Park. It's a beautiful area there. It's perfect for everything that will be beneficial to the residents here. Health, well-being, social interaction. So I'd like to thank Mr. Steve Miller, Councilman Wynn. I know they've got us to this point. If anybody else was in support of this, if not, this is your time to support it. So please just do the conversion. I appreciate it.
Hi, Craig Stofko, Wicomico County, speaking in support of the Naylor Mill conversion. I had a really good short speech to promote my book that comes out this summer. It's called Wicomico. It's about that guy and where he lived and what he did on that land. But I always go back to the county health rankings. Every time I do, all you guys fall asleep because no one ever looks at that stuff except people like Mr. McConaughey, who drives him crazy, I'm sure. But just listening to some of the health department report, and I used to run the health department in Somerset, this is just stuff that's only take a second. That I just popped up and looked at as to why we can't get qualified and enough people to come down here and work. Our cancer rate is not just higher, it's 25% higher. Causes what we breathe and what we drink. That land is right on top of the aquifer. We can't afford to keep making mistakes like that. Then 40% of the people in this county are obese. That's more than double the national average. 40% of the people in this county. So the recommendations are always access. Well, go online and look at access to activity in Salisbury, in Wicomico County. The first thing they'll mention is the Henry Parker Park, which is great if you're on a ball team and play. There's also a really nice forest next to it. The second thing on the list is Chuck E. Cheese. And you can't make this stuff up. I won't bore you with the rest of it, just to underscore. This land is so beautiful and special. I saw an albino deer. And I got a picture of it, so anyone who wants to call me on it. I saw an albino deer out there. Yeah, I'm still going out there. Haven't been arrested yet. It is paradise, and I know on both sides, people that are for this park and people that are against this park. Most of them have never taken the time to go out there. If you go out there, there's no sane person on the planet that could walk through that forest and say, we need this. This could be the thing in Wicomico County. Thank you.
Good morning. Well, actually, it's afternoon now. Robert Taylor, county resident.
If you're going to do something further on Conley Mill, can we get a cost accounting for the Safari and the Quarry event for a couple years ago? If you'll remember, that was going to be a moneymaker, according to Giordano. It was her deal. I'd like to know how much money we made or lost, as the case may be. I didn't come to talk about that. I didn't come to talk about the audit on the local management board, but I will say this about it. You all noted a lot of concerns. If you want to address something to the state, the council should do it, not the auditor. That's not her task. You all need to write a letter, whoever it might be, the AG, the General Assembly committee chairs under that particular legislation, and get it out under your name. You could use her report. She, Mr. Benson, and Ms. Hurley could certainly draft a letter. You need to get it out soon. It's not September yet, but the days of your council are dwindling down to a precious few. You got about 6 months left. So if you're going to start doing some stuff, you got to get going if you're going to make a showing. So let's get this done. Let's get that letter out by July, no later than that. You'll have about 4 months left then. Okay. Shout out, hold the applause for PAC 14. They did your work sessions this past week. Fortunately, I had a small part in that. I won't get into the weeds. There's also going to be a budget recap session, as I understand it, this Friday. I think it's from 3 to 5. I believe PAC 14 will be covering that too. And there's a lot that needs to be done in that recap session. And I'm going to get into the weeds from this past week. First, fire and EMS service. It needs a lot more funding. Ms. Giordano won't appropriate the money, won't ask you to appropriate the money. I know under the charter you can't up things, but you can certainly speak to her about that seriously. That needs to be changed before you pass this budget. Another thing that needs to be done, this came out on the Verizon building, health department. It's incredible to me, I mean, frankly, I was shocked that the CIP does not include various projects, and that is one, that are planned for the 5-year CIP period. There's nothing in there for it. I'm talking about this year's CIP. And I believe from your discussion last week, right now, there's nothing in it for the current one, the upcoming one. This is wrong, and I think there are other planned projects too. You all need to get that straightened out before you pass a budget, and that this is the time to do it, not later. Let's not have the next council, which is going to be a majority of new members, wade into this cesspool that Giordano has created. Thank you.
Hi, Holly Campbell, Wicomico County. Just want to say everything everybody else said for Conley Mill. Appreciate all those comments. They were really great. Rhonda, loved your speech. I wanted to point out a couple of things that, from my perspective, I've heard a lot in the last year about our ratings improvement that the county's, had the benefit of, which I think is fantastic. I think it's well known that one of the main reasons we have achieved that is because our fund balance is significant and has a significant improvement over the years. I would like to point out that Conley Mill was a gift that was given to the county and has probably provided the county with somewhere between like $10 and $20 million. I'm sorry, I'm hoarse. Probably $10 and $20 million of free money. So to me, that's a big fat deposit to our bank account. And our bank account just got us an improved credit rating, which also gets us better investments, better return on investments, cheaper money. We get to borrow at a lower rate. So I see Conley Mill for all these wonderful reasons, but if you want to get back to the money, people want to hear about money, there it is. There's a lot of benefit that has already been reaped from that donation. And I don't have the numbers to back up the 10 to 20. Somebody's got them. Weston Young studied that stuff early. Somebody's got them. So that's one thing I wanted to point out. To me, that was about somewhere between 14 and 28% of that fund balance that was on the audit record from 2024. That's how much I calculated probably came from there. Homeowners at Shadow Hills were asked back then during that donation period to get behind the project, to get behind the donation so that the county could benefit. I don't think they realized the benefit as much as they even did, but we were asked to do that, and in exchange, we were promised that the land would become a public park. And I want to get back to the wording on the land conversion. We have spoken tonight, I think other people have, that the water features, while they may be excluded currently because of the mining, there needs to be wording in there that protects that to be included going forward. And there is documentation, there are articles written. Here's a quote right here from Weston Young in 2018 that says, 22 years remaining at the current landfill, even with the dirt we have, it wouldn't be enough to close it in. Quote, and by creating deeper trenches in those ponds, activities for the community to enjoy could form. We would be creating water features for however the park manifests itself. We would have open water. Whether it's kayaking, canoeing, stand-up, paddleboarding, these could easily be stocked for fish. These were the conversations, that's a quote from Weston Young, those were the conversations that happened at Casey Taylor's dining room table in our neighborhood. And when we talk about the promise and you want to ask, like, where's the promise on paper? It's places like this that it's documented and in all the council minutes. So we would like to make sure that you include that somehow, that as the conversion goes forward in the park forums, that those water features get included later. I have more, but I'm out of time. Thank you.
Hello. Mark Carroll, Commissioner of Sharptown. I'm here to talk about the open space land transfer conversion. The property that it's being converted from is the property on Levin DeShiel Road, as we all know. And I thought it was important that I come and speak about this because there was a meeting about what to do with that park. And after that meeting, the town of Sharptown didn't feel that our needs were being represented. So when there was a follow-up meeting at the Mardella Firehouse, we organized most of the group that came there. We reached out to everyone else in Mardella and Hebron, other soccer programs. So the bulk of the people were on our behalf. And that was because that proposed park is actually in the Tri-Town planning area, specified in the LPPRP, which means it's supposed to represent the interests of Sharptown, Mardella, and Hebron. We wanted to make sure that our interests were heard, and that's why we did that. We wanted to make sure that rectangular fields were represented because that's what we needed. At the time, we weren't aware that there was an option to just not do anything, to do a transfer, which is actually the best option. Our programmings are more local focused, town to town. Maybe at some point we will need something like that, but to build it right now isn't necessary. So I am here today speaking on behalf of the town of Sharptown, and we have already sent a letter of support for this as well, but I'm here specifically to ask that you reach a consensus today. This is a time-consuming process, and we'd like to ensure that Mr. Miller has ample time to do what he needs to do. As many of you know, this isn't the first time that this has been attempted, and if a second attempt is made, we would love to see it go through this time. So we understand that the land conversion doesn't mean that a park can never go on Levin DeShiel. What it does is it basically just moves the obligation to another facility. And anyone who knows the cost of the park on Levin DeShiel would be happy to see that put elsewhere because who knows what kind of timeline the state is looking at for that park to be developed for as long as it has been designated open space on Levin DeShiel. So, yeah, that's all I have. Thank you.
Thank you very much.
Hello, Corey Houston, Wicomico County resident. I know everybody keeps talking about the fire, giving the city of Salisbury more money, but do you guys realize that they have two separate fees for city residents and county residents? You also get billed from that fire company for the ambulance call, what type of ambulance call, the care, the mileage is between here and there. I know from like our property is the city-county property line. I got a bill for over $16,000. Okay, Our insurance company paid it. So what are they billing Wicomico County for if the insurance company pays it? I know another one that came from this building alone, 0.7 miles. Guess how much that was? Anybody? $1,200. And it was not critical care. They got paid from the insurance company. So what is the city charging Wicomico County for when the residents and their insurance companies are paying for these services? Nobody can answer it. I've asked Nick Rice. Nobody can answer what they're billing the county for when the residents are getting charged for. City residents have a fee, county residents have a fee, you have a mileage fee, you have an oxygen fee, we have the type of care credit or care that you get. That's not just the ambulance call. It's broke down in their FY27 fees. So think about that. They're already getting money from insurance companies.
Hi, my name is James Darlene from Wicomico County. I'm here to support to voice my support of the land conversion to Conley Mill. So looking forward to the work session. Thanks.
Hello, Mary Hubner, Salisbury. I'm only going to just say that I'm here in support of the residents, specifically of Shadow Hills, who have worked tirelessly for this park, and I admire them so much because we need parks, as it's been said here, for a lot of reasons, mental health being a big one. So please, please support this conversion. Thank you.
Public comments. Seeing none, council comments. Josh?
Oh, I just want to say thank you for everybody for coming out today. Thank you for the folks who tuned in. A special thanks to the Shadow Hills folks, the Conley Mill advocates. You all have done a really fantastic job in being thoughtful about why this is important and why it's needed, and I completely agree. I want to get to actually address Mr. Stofko's comments. Despite the fact, it's interesting, we've heard two different things from folks coming up here, is that they, moved here because of the assets that we have, the rural, the nature, and all that. And we've heard from, what folks can do as far as getting out on the water, being hunters, enjoying the land as we have it. But we also hear this other part, which is basically about, Wicomico County continues to have some of the worst rates when it comes to diabetes, to a lot of our health issues. And though everyone, of course, always says, well, if you want to fix those issues, then you got to change your diet, which of course is challenging for different reasons. But the second biggest, if not the biggest way to address that is through connected green space. And that means not just having one great park and then on its own island, and then another great park in its own little island, another great, you've got to connect all these spaces. And if I would really love to one day look at the state rankings from our counties and actually not see our area down in the very bottom, Wicomico County. We have a ton of green space, but none of them are connected. And there are ways that we can do that. We've had rail trail things proposed and other kind of assets. So for the folks who are at Conley Mill, have been great advocates there. I'd encourage you all to turn around that energy and effort and put it towards, as we go through updating our comprehensive plan. Let's make sure that we not just have really great spaces, but that you can go from one to the other by a bike, and that we can have more spaces from our urban core for people to get out and walk. We can't do anything particularly about the really poor, awful development that we had North 13 where the mall was created. Remember when I remember watching that thing being built. All of that area, you see any sidewalks out there? No, you're going to get hit by a car, but you will always see people trying to walk. So connectivity is a really big issue for our county. I want to make sure that we continue to address that in our comp plan, and then when we update our land preservation, parks, and recreation plan. Thank you. For folks who've mentioned that. But anyway, so connectivity, that's what I'd love to see. I appreciate everyone for being out and for voicing your concern. Thank you.
Joe.
Being it's 90-some degrees outside, let's talk about snow. I just want to say a big thank you to our county roads department. I think they finally, and they've worked really hard at getting all the trees up alongside the roads. It's been a, I see Mr. Corey out in the audience there. It's been a large task. We had a neighborhood north of Parsonsburg that really had problems and kept calling me, and I kept saying, they're on their way, they're on their way. And finally one day the guy said, hey, they're here. So he was tickled to death. I know they were tasked very heavily with trying to take care of the problem that we had with that snowstorm. Tomorrow they're going to have a ribbon cutting at the Parsonsburg Library. It starts at 10 o'clock. If anybody wants to come out, it's been a long time coming, so it's going to be a nice event. I want to comment on a couple things that somebody said at the podium about us, the council, backing up the internal auditor and things that we should do, excuse me a minute, let me look this up and get it right here, that we should do to, how come when I look for something I can't never find it? That's something. But anyway, we asked for information about the LMB. Now, this isn't new. This is something that, questions have come up about this for the past several months. So we had, I had Laura send a request over to our Director of Administration asking for all the information, correspondence and things, so we could get to the bottom of it, Well, what we got was a reply that there was just a lot of just conversations, and this information was going to be not timely coming to us. Now, I thought about that answer, and I thought if there was a CEO of a company that sent that request to his department head and said, look, I want this information about whatever project you've been working on, and they got that response back from that department head, that person would be at somebody's HR department looking for another job. But that's the kind of lip service we get. And it's not just this issue. It's been a lot of issues over the past few years. So it's, the lady tries to do a good job. What Mr. Atkins brought up at the podium, we've heard that so many times. So that's one of the issues we have. So that's all I have. Thank you.
Jeff?
I'd like to thank everybody for coming out. Again, daytime meeting. Appreciate you taking the time to be with us and share your opinions and concerns. You might have noticed it's an election year. Just drive down the road and the campaign signs are plentiful. We're getting a lot of contacts about the signs. Some of them apparently are in the wrong place, and we just refer them to the county roads department and state highway and let them take care of it. Please get out and vote in June in the primary. I know it's a primary, it's a mid-cycle, mid-year election. Get out and vote, please. Get informed. There's plenty of town halls. There's going to be some debates. Please go, get informed. Learn about the candidates, learn what they stand for. And when they tell you in a public setting how they're going to reinvent the wheel or move a mountain from one side of the county to the other, follow that up with how are you going to do that? Because it all sounds good. It all sounds good during the campaign season. Find out exactly how they're going to do what they tell you they're going to do. That's all I got. Thank you.
Again, sometimes I forget to thank people for coming to the meetings. I'm always glad to see people here and not just us. Let me take my glasses. I can't read with my glasses. I want to congratulate Shadow Hill for your continued fight for Conlon Mill Park. I was on the city council when the property was donated, and that was many years ago. So now it's coming, hopefully, in fruition. And I agree with, compliment Steve Miller for his dedication to have these parks around the different neighborhoods to give people recreation and families to have a place to go, socialize, walk, all that kind of stuff. Also, I'm concerned about senior citizens, because I am one, is heat. It's going to be a bad summer. It's going to be very hot. And we need to check on our elderly neighbors or family members to see if they have a fan, see if they have food, because of the economic situation right now in this country, some people may be choosing between food and medicine. But we need to check on them, and also the pets that you see outdoors with no water. Turn those owners in, because it's going to be extremely hot this summer. And also during the winter months, we should also do the same thing, make sure our seniors have proper heating and food. I think that's all I basically have to say right now.
Under presidential comments, pleased to have everybody here. As usual, it's nice to see a crowd. In reference to the audits, the internal auditor, so you're aware, will be presenting an annual audit plan for fiscal year 27. That'll be in about the July time period, where she actually, puts together her list of what she wants to review in the next coming year. We'll certainly make sure that we do revisit the departments that have, demonstrated to a certain degree either a lack of compliance or questionable findings, because I think we need to keep on that it's 100% correct. And we have seen way too often where there's new employees or the process hasn't been trained properly, et cetera, et cetera. And I guess, yes, in a matter of a first year or two, that's could be considered acceptable, but it has gone on for quite a while. And I think it's more importantly that we do try to make sure that we keep a line on it going into this next year. This council will not be there, but I agree with what Councilman Ennis says, and that is the fact that I think we do need to, with the assistance of the internal auditor, come up with the legislation which would create a greater call to action on behalf of the council to enforce those issues or those violations that might occur, because right now it's a report, it's brought to the table, and then we move on to the next item. So I think something more tangible, I think, is needed, without a doubt. In regards to the roads audit in particular, I was a bit taken aback by what I would consider an unusually inappropriate response on behalf of the executive branch. And we did respond to that. I personally responded to that diatribe of criticisms on the internal auditor. My point being is anytime you have an internal auditor that comes into your departments and wants to address issues and finds findings that they're concerned about, I don't think it's your prerogative to criticize that internal auditor and maybe suggest other ways that this individual should be doing their job. No, you should recognize the fact that the internal auditor is trying to assist you and to help you and to help your departments run more efficiently. and 110% cooperation is what should be required. So, as I said, we did respond to that. In addition, we also did make a point on this specific audit that the internal auditor include, and this is a very unusual process. You don't usually get 3 pages from an executive branch critiquing an audit. So we also asked the internal auditor to please include her very unusual rebuttal to the executive's letter. And Mr. Atkins, that's why you had a 3-page series of comments and rebuttals, because we wanted to make sure that was on the record, not only so that the public would recognize what was happening, but also to defend what we felt was the integrity of the internal auditor in a very, sometimes working in a very challenging role when it comes to just trying to get good information. We will continue on once we move out of once we move to the work sessions. We're going to do the Project Open Space work session for Conley Mill, and then we're going to take, just so you're aware, then we're going to take a half-hour lunch before we come back to the rest of the work sessions. And I want everybody in this room to know that, so that you're not just sitting here anticipating anything different. So that being said, entertain a motion to adjourn so that we can, hang on a second, I have to read the formal one here. Hold on a second. Entertain a motion to adjourn from legislative session to go into an open work session, followed by a closed work session pursuant to the local government article section 3-305B1 to discuss a personnel matter pertaining to the general service to supervise to protect the privacy of personnel discussions. Second? All those in favor?
Aye.
Opposed? Meeting's adjourned. First open work session is program Open Space Land Conversion from property known as West Metro Core on 11 Shield Road to the Conley Mill project on Conley Mill Road.
Good afternoon, Mr. President, members of the council. Steve Miller, Director of Recreation Parks Tourism for Wicomico County. Thank you for the opportunity to be here today to talk about the program Open Space Land Conversion. If it's okay, Mr. President, I'll be very brief. I know it's been a long morning, but for the sake of the public, I wanted to just take a quick moment to explain for folks watching what a land conversion is and what it does, and then talk specifically about what's being proposed here today. Most counties in Maryland, including Wicomico County, rely on a state grant program called Program Open Space. We refer to it as POS, to both acquire and develop park properties for public recreational use. The program's it's a model program across the country. It's been in place in Maryland for over 50 years, and that's the main funding source that we utilize both to acquire and to develop our 40 park properties. Most of them are tied in some way to Program Open Space. Like most grant programs, Open Space does have some strings attached. On the acquisition side, specifically with the issue today, when you acquire property with POS funds, there's a perpetual land restriction that's written into the deed that would require that property to be accessible to the public and then to be exclusive to public recreation use. So, for example, we couldn't purchase a property with open space and turn it into a recycling center or turn it into office buildings or something like that. It has to be for public recreation, open to the public, and that is intended to be a forever designation. The one exception to that, if something happens in a jurisdiction, if plans change, if a jurisdiction wants to repurpose a property for something different, if they intended one thing and then things change, the one exception is what we're talking about today, which is called a land conversion, which essentially lifts the obligation from one piece of property and moves that obligation to a different piece of property that would then be obligated under POS rules. I will tell you land conversions are very rare, and that's by design. The state wants them to be rare. They're very time consuming, very hard to achieve. Generally speaking, when you apply for a land conversion, that's a 12 to 18 month process. But that is the path that the state has provided should a jurisdiction be in that situation. Again, for information purposes for the public, according to the POS guidelines, there's 3 criteria that would need to be met for the state to even consider a land conversion. Criteria 1 is that the property you are converting to has to be equal or greater acreage. It has to be a bigger property. Number 2, it has to be equal or greater as far as appraised value of that property. And then thirdly, it has to be equal or greater to recreational value. That one's a little bit more subjective, but you have to make a case that this is of greater recreational value to the residents that you serve. So if all three of those are in place, you can't have 2 out of 3. You need all 3 of those in place. Then the state would consider a land conversion in that case. But that is the provision. Yes, sir.
Who makes that decision on the state level?
There are 3 departments. So it's Department of Natural Resources, state, the Budget Management, and then Planning. So you'd need all 3 state secretaries to sign off.
Public Works, Board of Public Works.
The funding, yes, this would go through the Board of Public Works, but those 3 secretaries would have to sign off on a conversion and evaluate. So that, generally speaking, that's what a conversion is and what it does. It places that restriction. Now today, as you've heard, we're talking specifically about a proposed land conversion from the West Metro property on Levin-Dashiell Road that was acquired with open space funds back in 2009. And that would be shifting that designation to the Conley Mill property, which was donated to the county back in 2019. Some of you are aware of this, but that conversion was proposed back in 2020, and actually in the spring of 2021, the state did approve that. All 3 secretaries did sign on, but that was not adopted on a local level, and so that ended up getting pulled, and that conversion did not take place. Since that time, we pivoted and we did a master plan at West Metro, which you heard referred to today. But for various reasons, to this point, nothing has been developed at Levin-Dashiell, and it remains essentially farmland at this point. But it still has, as we speak, the program open space designation. So that brings us to today, and I did advocate for the land conversion back in 2020. I still obviously, I'm here to advocate again for this conversion. I do think it's in the best interest of the county. I think you've heard it in the public comments, but the opportunity at Conley Mill is a tremendous opportunity for a lot of reasons. It's a very unique one that I think would benefit both our residents and visitors to our county. You heard referenced its unique natural features. Conley Mill is a unique property. We don't have a lot of properties like it, that have elevations like it, that have features like it, and we have an opportunity to provide some amenities that we don't currently have, and that's unique. You don't get that opportunity often. Mr. Hastings mentioned proximity and connectivity. Where it sits, you have the opportunity to connect both to our Henry Parker Athletic Complex, which is a jewel in our park system, and also the city of Salisbury's Naylor Mill Forest, which they have a bunch of trails, and you have the opportunity to connect all 3 together and really make that a unique and very special opportunity, again, for folks who live here, but also our visitors. And then you also have an opportunity, and some of you took part in this last year, the state has indicated that they're open to partnership park type opportunities. And when you take a property this large with the opportunity to connect city, county, and potentially engage the state, I think you have additional opportunities there, which I think we could certainly leverage and take advantage of to potentially develop this into a park. So in my view, I would could keep going, but I would just say that these opportunities are too good to pass up. We have a second swing at this, and I do think this would certainly be in the county's best interest. I'll also point out before I finish, and I think someone made this comment, doing a conversion of this type would not eliminate the possibility of a park at Levin-Dashiell. What this would do is remove the obligation, remove the restriction, but essentially what you would do is create a blank slate at Levin-Dashiell. So if it's the will of the county to still build a park there, you can still do that. That is still an option, but what you're doing is eliminating that obligation that would come with that program open space designation. And so that would be, in my view, a separate matter that the executive branch and legislative branch would decide what do you do with that property, but it would remove that obligation. Lastly, in terms of process, I've talked with our state contacts. They're aware of this meeting today. They have told me that the approval process in this case, because the state has already looked at this once and already approved this once, now granted it was different people at that time, but they said since it has gone through that process that likely this would be much quicker. So I would hope somewhere in that 6 month to 12 month as opposed to 12 to 18, maybe faster if we're lucky. And If the council decides to move forward with this, we would request a letter of support from the council indicating that this is what the county wishes to do, to pursue. And that would give the state the assurance that this is the direction that the county wants to go. We've updated the appraisals that are required. We've updated the application materials. So should the council want to move forward, we could send this off by the end of the week and get that process started and get that moving. So with that, I'd be happy to answer any questions or address any issues.
Just for clarity, I guess on that process, you're saying for, you said, of course, the process could be longer, and then also mentioning the council moving forward with the letter. I would love for us to move forward with the letter today to go ahead to support it. I don't know if that's something that's needed now, or if that's something as it goes further to the Board of Public Works and others.
I think, I'm sorry.
No, that's it. Yeah.
Yes, so I think it would be helpful, frankly, on the front end, just in light of the fact of what happened the last time. So I do think that would, our intent would be to, if the council wants to go that direction, would be to submit that with the application, that this is the direction that we'd want to go.
After we get this done, if we get it done, I know that a lot of the folks in that area, and it's been in support of this, has wanted this park to stay in a more natural state.
Mm-hmm.
Is there things that the council can do or the county can do to ensure that that it will stay instead of it becoming say a motorized park or a lot of different things that wouldn't fit into the norm? Can we do restrictions on that after we get things changed?
So it will come with inherent restrictions with open space that would fall into that category, but as far as passive recreation, active recreation, so if you're suggesting like to restrict it from like building more ball fields or something like that,
right.
That would be, in my view, I think that would happen in the master plan process. So if this was designated a park, we could initiate at some point a master plan process, and that would be the point that the public certainly would be part of that, but then an executive and legislative branch would decide that. So I don't think on this end, the designation that exists would say it's open to the public, it's public recreation, but I don't think we would decide what it is at this stage.
I know it's early.
Yeah.
The other thing, the Levin to Shield property, at some point in time, can the county apply for more program open space money for that if they wanted to?
To develop it?
5 years from now, 3 years from now, whenever?
Yes.
Okay.
Yes. So with I mentioned the forever restriction on an acquisition, unless there's a land conversion. If you use funds to develop it, then there's a 20-year obligation that you'd have to keep that open to the public for that 20-year period. So we would just have to do it with that understanding. Jeff.
Morning.
Morning.
I got a couple things here. The Levin to Shield property is currently leased to a farmer.
Yes.
It'll stay that way, right?
I think in the short term, yes, and then until decisions are made as to what to do with the property.
You know how
long
long
term.
the lease is?
We did it annual, not knowing if we're going to develop it, so we did it annual with renewals.
Year to year?
Yes.
I see in here that the 55 acres that is the borrow pit is not included as part of this proposal. Would it be part of the proposal after the borrow pit is over with, or is that a forever thing?
So it doesn't have to be a forever thing, but I will tell you, I did get an answer to the question that was asked yesterday. I did talk to DNR this morning. They said they would not approve including that in the conversion if we're going to be digging more than 3 to 5 years, which my understanding is we have longer runway to completely mine that. So what they recommended is we convert excluding the ponds, which is what we did the last time, allow that work to happen. And then if and when down the future, once that work is complete, I certainly think you could incorporate that into the park, but it would not, in this particular conversion, guarantee that as far as in the deed.
For now?
Correct.
Okay, all right, thank you.
Have you ever done anything about fencing?
I have not. I'm not. Again, this is not a park. I hope to have that problem someday.
So that's that fellow's problem. Okay, all right, we'll talk to him about that. Okay.
On the borrow pit,
Yes.
do we know what is our obligation time-wise for the existing situation for the mining? Is there a set time that it's going to be used for that purpose?
So I would defer to Mr. Corey on this.
Adam Corey, Deputy Director of Public Works. So, yeah, Steve and I have been talking about this quite a bit, and, you know, the engineer's estimates from the limits of disturbance that we have permitted could take you to 2040. That, you know, and Steve and I have talking about the fact that this designation move of open space monies, this gets us in the right direction for Conley Mill to come to fruition, right? But taking ponds to 2040, does that get us where we want to be from the standpoint of some of the other concepts that are laid out for the use of the property in the future? Those two things, I think, are in conflict with each other. So we got to determine, you know, the will of the council, the will of the people, and the will of the use, to see, is that really truly going to be the timeline?
So you're stating how long they can be mined by our current permit?
Based on our estimates, based on the needs, like when we take the data and go down what the needs are going to be per year, you have like a standard set daily cover regimen of X amount of cubic yards, maybe 50,000 cubic yards, for example. And then you say for a horizontal expansion, which should be coming on to play in 2029 through 30, you may remove 300,000 cubic yards of material. All those different years into the future are planned out in our estimating documents. That's where we came up with that. You know, could you dig it all out faster? Sure. Question is where you're going to put it. And then we have to weigh other things as well. We've also, since this conversation has been going on, we've also changed how we're assessing and utilizing dredge material for beneficial reuse. So every 10,000 cubic yards of dredge I'm utilizing for intermediate cover at the landfill. That's robbing Peter to pay Paul. I don't mean that's not really the right saying, but that's 10,000 cubic yards that could have come from Conley Mill.
It would extend
exactly.
the
So
lifetime of the borough pit.
at the end of the day, what I guess I'm trying to offer the council is, and Steve and everybody out there, we want to make this work what's right for everybody. So the timeline, we need to discuss what it's going to look like. Yeah. But I know for a fact we can easily get, and we should, especially when we take into consideration horizontal expansion, up until and past 2032 for absolute sure, because you're going to need that material without a doubt. And dredge material is not going to do it. You need select fill.
Well, my understanding was dredge material may not work anyway because of its consistency.
Well, so we've had conversations about that, specifically me and you here at this table. Okay. And pleased to tell you the dredge material we're using as intermediate cover on our exterior slopes is holding up very well to erosion and sediment. And although it's dry as a bone right now, you hydroseed that stuff and it starts growing quick.
Good
so it is good. That's actually working out pretty well. But like I say, it's just all about having a conversation. I frankly think about, what the desires are. But we need that select fill for horizontal expansion, for no doubt, and that's going to be significant.
Just a quick question. You don't have to answer this, you said we could be digging for about 10 more years.
You could, more than that.
If for some reason it could be sped up, just because you just can store it somewhere, would you be able to store anything possibly on the Potts property and then transition from there to the landfill as needed?
It's a good question. Conceptually, you don't want to handle it twice.
Right.
You don't want to handle it twice. The nice thing about when you get material closer to the landfill, when I say that, I mean within walking distance of it. Yeah. Now you don't have to take it on a road. What's behind the landfill that we use in stockpile material, whether it be intermediate cover, daily cover, other mulch materials, whatever the case may be, you can throw an off-road truck to that. And an off-road truck is just that. It's staying off-road. It has double the capacity of a tandem axle dump truck. And so that's where you're loading the material yourself, bringing it yourself only maybe a mile and a half, versus hauling it from Conley Mill. We're already doing that every day.
Right.
We're literally stockpiling our daily cover from Conley Mill right there in our back area behind the landfill. We have to do that already. The question is, how much room do you have? Well, Potts is our next mine. That's what it's for. Again, I think it really just, there's plenty of concepts up there. I think it's just really, what's the will of the council, the administration, and the people of how long do we want to forestall that? Because,
But you don't have to answer that today.
it'd be hard to without knowing all the factors. But, like I say, there's options there.
Thank you.
Mr. Miller, appreciate you being here, and Mr. Corey, too. There's no doubt, I think the council is willing to move forward, or actually anxious to move forward to make this conversion happen. It's a series of, I guess, timing. If we were to do this, and let's say that the state were to grant the conversion within the next year, it sounds to me like we would still have to wait 14 years in order to begin the process. If we convert it, how many years do we have to sit on it? I mean, we sat on West MetroCorps for many, many years, I understand, but isn't there a time limit for program open space?
Yeah, usually the threshold is about 5 years. That is what they want. They want you to do something with it. They don't like what's happened at West Metro, which is it's sat for a long time, and that's part of why I'm here, is we got to do something. But to answer your question, I think there's 234 acres at the property. What we're excluding from the conversion is about 55 acres, which is where Adam and his team are working. So you got 180 acres to work with. So I certainly think you could do that while that other stuff's happening. That you would have to put, as Mr. Holloway says, protective measures in place, and you've got to organize it so you sequence it in a way that makes sense, and you give access to the property to parts where you want people to go and not to go. So I certainly think you can phase that, and I think that would be our intention, is to do that.
So it wouldn't hold up the development of the park?
No, I don't believe so. I think you just have to be strategic to stay out of each other's way and make sure that you're getting people where you want them to go, and keep them away from where you don't want them to go. And I will say, this did appear in the CIP. One other thing I forgot to add is that over the years with the farm lease at Levin DeShiel, we've collected funds for that farm lease. So we have about $300,000. And the expectation from the state is that money goes with the land the restricted property. So essentially, we'd have about $300,000 you could start a master plan, or we could do like we did at Pirates Wharf, which is use that money to leverage to get grants and start that process. But I think initially you'd want to start with a master plan, so we could look at that whenever we get direction to do that. So,
Is council okay as far as moving a letter of endorsement forward? Everybody's good, right?
Yes.
All right, so we can do that. Ms. Hurl, you can put that together. She's very quick about doing that. So
She's probably got it
before the
drafted
end of the
already.
week.
all right, that would be great.
I have
Thank
one
you.
thing.
Yes.
Yeah, Mr. Corey, before you and a lot of people that's sitting in this room, and a lot of people on this council, we had multiple deaths on Mount Herman Road in a
Corey.
Mm-hmm. Sorry, Mr. Corey.
Oh, I know that one.
But
Different
anyway,
spelling.
And in fact, we had 2 in one day. Could you put together a cost of fencing that in?
Yeah. So
I've asked this over numerous years now.
$2.5 to $3.2 million to get that the entire. No, that will be for the high fence like we have around the pit at the landfill.
I don't think you're going to have any fence that's going to keep people out if they really want.
Oh Lord, you're not kidding. I mean, it's keeping honest people out.
That would 6 foot tall.
Yeah. I can go back and get calculations on that. I bid it out. Well, I didn't bid it out, but I calculated it based on what we already put at the bar pit there, which is that's 10 foot with chain link and barbed wire angled out. I will certainly get that. I'll certainly get some numbers for you.
And I tell you, Ms. Shields mentioned it a while ago about how hot the summer is. Kids discover that place.
Oh yeah, sure. And that's the other thing about the ponds themselves. No matter what you do, and into the future, if and when you decide to say, okay, let's move towards the water features as everybody would desire them to be, you still got to put a significant amount of capital expenditure into reclaiming them so that they are safe.
Right.
There's only so much Mother Nature can do to get those sediments to level in there and make those edges hard. Right now, you can sink right to your neck.
And Adam, and that's because it's a quarry, and quarries, you just sink.
There's no benches
and then it's straight down drop off on the
Yeah,
side.
you gotta be really
So
careful.
It's not safe at all.
Not
the way it
sloped.
is.
It's not.
No.
Sloped, yeah.
No,
like
and that's what
normal
we would need to do. You'd need to reclaim them that way with proper slopes, benches, stops. That way, if you did have somebody that were to roll down a certain part, you want to get rid of those 4-to-1 slopes. That's a lot of earthwork. Not a lot of earthwork, yeah. But yeah, I'll get you some numbers on a 6-foot chain link fence. You know, anybody wants to get over it, they can get over it. But at least it's there, I guess.
Liability.
Yeah.
Do not.
Thank you both very much. So, Mr. Corey, how long do you think your presentation on the Cooper Road surplus is?
Mr. Illuminati and also the property owner.
All right, then we're going to recess.
Okay.
20 minutes.
All right.
We'll reconvene.
Yes, sir.
Okay.
Thank you.
Thank you very much.
Appreciate it. Thank you.
So we're going to recess for 20 minutes. We're reconvening as the Wicomico County Council for May 19, 2026. The first item on the open work session agenda is declaring 4980 Cooper Road, Eden, Maryland as surplus property. Gentlemen, thank you all for being here.
Thank you. Good afternoon, Council. This is Adam Corey, Deputy Director of Public Works.
And Andrew Illuminati, Department of Law.
So, good afternoon. In the grand scope of us trying to continue to take slices away at the monster that is dredging, and especially as the Wicomico River is pertaining, we started looking this past season into some new alternatives of all sorts. You've heard me talk about the partnerships we formed with other NGOs and other government organizations outside of county to work with us on placement of sites right on the water, you know what I mean, as far as immediate placement sites versus using sites like Sharps Point. However, we also know that even if we get those, as many of them that we hope we get, we're still going to need related upland or inland management sites of some sort. So while we've been trying to do that, we've been looking into outreach to other property owners. We've had property owners reach out to us directly. And we've also looked at our historic list of properties that we had at our use and disposal for dredge material management. So as we start looking at the property on the right-hand side, the one that we are asking to be considered as surplus during this work session, located on Cooper Road, is 16.93 acres that was previously, at some point in our history, utilized as a dredge management facility, where it was bermed, it was excavated. You effectively have two ponds there, for lack of a better term, and then at some point, the U.S. Army Corps put in what I would say a relatively modest amount of dredge slurry, because this is in no way, shape, or form the size or scope of our Sharps Point facility, for example. And if you look at Google Earth sometime, just go on down the Wicomico River, especially when you even get past Bull Lips, for example, and the Red Roost, you'll see these little pot marks, square rectangles on the satellite imagery where this has been done time after time. So as we start looking at this particular property to potentially rehabilitate it so it can be utilized again, a couple things stared us in the face. One, it's not been touched in a long, long time. So vegetative removal, rebuilding the road, the whole 9 yards, the list goes on and on and on. And it's full of dredge material. The blue is a little deceiving. There is water in these ponds, but they're also full of dredge material for the most part. So at the same time, a gentleman that owns a property immediately adjacent to this happened to grab my attention and say, I've got a property I would be considered, if you would like to look into, as doing effectively a swap. Which brings us to the property on the left-hand side. This is the Disharoon Road in Eden. It is 24.005 acres, and it would be a suitable upland site. So we started to do a little bit of math. What would you have to do to rehabilitate the existing one that's on Cooper Road and remove that material and take it where? You'd effectively have to do another 5 or so acre NOI site like we did at the Allen site to move stuff from Sharps Point. This one being further away from Sharps Point, it just doesn't make sense from a cost standpoint of transport. The 25 acre piece that's in Eden is about 1.2 miles away from Sharps Point. So there's a couple options here. if you were to take on this property after naming that one a surplus, you can relocate material from Sharps Point there by truck, which is, again, pretty close. Or U.S. Army Corps just did offer this up. We were on the phone with them a week and a half ago. He said there's no reason why you can't slurry discharge into Sharps, booster pump out of your last cell in Sharps, and lay a new pipe easement over that 1.2 miles and pipe it into this. Again, you would have to permit and build that as a dredge management site, but
You're talking about the property that's is it across the highway on Sharoon, or?
kind of right behind, if you're looking to the northwest, right behind how sweet it is.
Yeah, okay, so it's on the right side of the highway.
Going south.
Yeah, okay, all right, yeah.
So we looked at it. We personally, professionally, we think it's a win-win. We're getting a larger property for a swap. We are not having to intensify rehabilitation of the property that is on Cooper Road, and we have options for both dry transport and stockpiling, or slurry discharge and pipe easement, and having the Army Corps utilize it as a secondary site to supplement Sharps Point for dredging opportunities. Now, all that being said, we do this. You can't put material on it immediately. You got to go through the process, but it does give us some options.
And you said they can pipe that from Sharps Point all the way to that piece of property.
So,
Wow.
Councilman, when the pipe easement that goes from the river to Sharps Point is 4 times as long as the distance is for this almost.
Okay.
So, I mean, we can pipe a long way.
Wow.
Yeah. Lay pipe underground, a couple of culvert crossings.
What about easements and right-of-ways to get across other people's property?
Certainly. So,
I mean,
it's a little hard to see. I can bring it up there a little bit closer, but if you look at the left-hand side, I don't know if PAC 14 can zoom in there or not, but there are deeded easements, deeded 30-foot right away in there from Stockyard Road. There's also access coming in from Disharoon, and they are a candy cane red and white stripe on that map. So there's deeded access to it. Yeah.
That's good.
Any questions?
Just, I guess, cost-wise, what does that cost to, you already said that for,
Yeah, so this particular swap, I mean, really, that's what it looks like on paper. We paid for some appraisals for this to go through. Again, if the council is agreeable to this, then we would have to do the subdivision, which is effectively having a survey plat prepared. I mean, it's pretty standard for minor cost in the grand scheme of things. The next cost associated would be our permitting and whatever we decided to do. If we decided to fully develop this as a dredge management site similar to Sharps, or if we simply want to pick away 5 acres at a time and store 100,000 cubic yards at a time. In my opinion, I'd rather, again, I would do somewhat of an in-house feasibility assessment, but I would prefer to do, shoot for the moon at the first blush. Now, depending on your permitting, but when you build a dredge facility like you do with Sharps Point, you can utilize material to build those berms. So it's not like you're bringing in foreign material. You're effectively solving your problem of overburden at Allen or Sharps by building berms on this property. So, I mean, I hate to say this, kind of corny, but it's a win-win.
if you heard about the cost for the infrastructure to pump?
Oh, so that all goes into play when you talk about the U.S. Army Corps of Engineers. When they do their piping, we have to take care of the easements. We have to take care of the arrangements of the payment to the property owners for those easements so the pipeline crosses over. The U.S. Army Corps and their contractors are the ones that bring the pumps, they bring the pipe, and they set up the water control features and the decant features and stuff like that. Effectively, that's on them. What we have to do is supply the site. Now, we would have to do modifications to the site to make it useful. But again, that's my goal would be to utilize in-house work, in-house labor, in-house equipment, things like that.
Assuming you can pump, it sounds like you can, there's going to be a huge offset cost-wise from not having to truck.
On the county's part, certainly.
Yeah,
Yeah,
that- you know.
I mean, the Army Corps, I don't think they'll see the cost offset like we will. We'll say, okay.
No, it's going to be on our
Exactly.
on our side. That could
Yeah.
be a big, very big number.
But even if we had to truck some, all right, again, it's so close.
Yeah.
It's different than going from, because right now in phase 2 of Sharps Point relocation, which is underway, that company is taking it from Sharps Point and bringing it all the way to the Bricktown Road. It's not, we're not taking it to Ocean City, but it's a decent route.
Money.
Yeah. Decent route.
And the majority of the dredging that's being done, where is that primarily? Where would you say that stops and starts?
So you've got the upper, the middle, and the lower, right? Because of the geophysics of the river itself, you have your siltation and alluvial impacts that occur, and your upper faster rates. The shoaling rates can be faster, especially on the tight turns of the Wicomico County that are nearest to Upper Ferry, for example. Because of that, you can have the shoaling rates get higher than they would be if you were in the flatter, broader part of the river as you get towards Ellis Bay, although you still have it. And different forms of sediment as well. You get sandier as you go south. When the U.S. Army Corps does its survey work, which they're still working on some of it, they give you those shoaling rates, and they show you exactly where they want to do spot treatments. And that's effectively, you do these cycles. Part of it's a spot treatment, part of it's a clean sweep, if that's layman's terms. But the majority of the upper is between, the port and just south of Upper Ferry.
You don't think that this property is going too far south?
Well, this one's not going to be a direct placement.
Okay.
Yeah. So what they're going to do right now with the upper in this particular cycle, just like they did the last cycle, is shoot it into Sharps Point. This particular property is only 1.2 miles from Sharps Point, the way the crow flies. So pumping it that much further from Sharps, not a big deal. Because if you pump it into Sharps Point, then you have another cell that's, imagine this cauldron is, you've got your water and your sediment slurry, and then you take another pump structure and push it from Sharps to this property as you're doing one project. That's the concept. That you could do.
Okay.
At least Army Corps feels pretty good about it, in theory.
Questions on it?
Aside from the adjacent property owner that we know about, are there others that might need to know what we potentially will do with this property?
The 25-acre piece?
Well, the 25-acre piece, that's Mr. Malone's, right?
Currently, yes. Mm-hmm.
Are there other ones around there?
Mr. Malone met with the property owners and told them what his intention was.
Okay.
And what the county was going to most likely use the
Intending
utilize
to
property
do.
for, correct?
Yeah, and I'm a contiguous property owner still on one side of it, and it's a continuous operation bar up for the last 50 years. It's been a
Okay.
contiguous property, so they're used to that
Yeah.
type of operation.
Just trying to
Well,
avoid
would you want
any.
to come up next to Mr. Corey, just repeat what you just said so everybody could hear, so the public recognizes it? Thank you, by the way, for being.
Brent Malone. I met with Kyle Kenneman. He's now the owner of Bennett Construction. It's been a continuous operation borrow pit contiguous to this site since they built the bypass, I guess. And so the local traffic is acclimated to that borrow pit dump truck on a daily basis. And we've had a good meeting there, and I'm the other contiguous property owner, still retain 40 or 50 acres.
Okay.
Thank you.
Mm-hmm.
So it's a really good location.
Yeah.
It's not going to impact a lot of people.
Are those quarries next to that 25 acres?
Yeah, right in front of it.
Oh.
I mean, literally, those two blue.
Yeah.
You see the blue ponds right there on the left-hand side?
Yeah.
Those are Kyle Kinnaman and Bennett Construction's pits right there.
Is that, I don't want to speak for anybody, is that?
I wouldn't want to speak for him today either, but it's certainly advantageous to have that right next door.
I won't say anything.
Yeah.
I guess the question is everybody okay with moving forward on the surplus, understanding the fact that then we would also be okay with doing the exchange and everything else that Mr. Malone and Mr. Corey has put together? I'm
good with it.
We okay with that?
You have right-of-ways, correct? Yeah, I think you mentioned that
Sir,
we do.
yeah, the easements, yeah, the 30-foot deeded easements.
We got a
If I might
right-of-way to
add,
this
it has a-
property?
I'm sorry, Mr.
We have a
Holloway.
right-of-way to this property?
Yeah, the 25-acre piece?
Yeah.
Yes, sir.
Is it along a road?
Stockyard. And ditch a road.
So it borders a road?
Yes, sir.
Okay, all right.
We'd have to improve it, you know. You'd want it to be improved for heavy truck traffic, but
The only other difference is the 25-acre parcel is appraised at 195,000, and the county Cooper Road parcels appraised at 85. There was not a request for payment for the difference, but to categorize the 110 difference as a donation. That's pretty routine. I know historically, the most recent exchange that we did was with the university for downtown, and that was just an offset with a government entity. But there's some paperwork, and I've done it in other jurisdictions. It's nothing that complicated. There's government forms, and we just acknowledge the difference between what he's getting and what we're getting, and the values in in our favor. And
I think still comes out as a positive.
yes.
correct.
Yeah, right. So, Adam, I really want to thank you very much for going above and beyond. I mean, the community outreach is incredible, and Mr. Malone, we thank you for helping out as well.
Big help.
Very unique exchange, so it's...
Win-win all the way around.
Absolutely.
Yeah, sure, because we've definitely been in the bind, and it's going to really give us a lot of breathing room, I think.
We're going to keep going there. And like I say, Councilman Wynn just gave me the phone number of someone that is interested in talking about their property down on the Wicomico as well. I think, again, this conversation keeps growing legs. More people get involved in it, we're going to be, the better off we're going to be. And I appreciate Mr. Malone, and he's really worked very hard with me on this and putting it together. So we're happy. From here, this being a work session, it would be from here getting the resolution stuff put together.
It's a public advertised hearing because we are surplusing the property, and then specifically, this is unique because it's not going to go to public auction or go to really anyone else. It's going to go just to Mr. Malone. So that will all be laid out in the resolution with the requirement for the subdivision, because to the parcel that's going to be, the portion that's going to be exchanged is outlined in red, but that currently as deeded, it's one entire parcel with what's to the right. It's about 50 plus 60 acres. So it's going to be split up. So the council ideally will approve the surplus and the exchange. It will then, before we sign any documents, go to Planning Commission, get the approval of the Planning Commission. I don't see, we've talked with Tracy about that. Don't see any issues on why Planning Commission should have any problems doing a subdivision, and then we could go to settlement. All right.
Mr. President, I just want to mention the public hearing on the surplus property will be held at the next meeting, which is June the 2nd at 6 p.m.
I want to thank Ms. Hurley for that, because otherwise with the advertisement schedule, we were looking at second meeting in June, and then it just drags out that then you can't be on the Planning Commission until possibly August. So just one meeting and having it the next meeting is going to make a huge difference in getting this moving forward a lot quicker.
Is that with the public hearing and resolution combined?
No, you'll just have a public hearing. Per the code, you have the public hearing one legislative session, and then you have to vote the next legislative session.
But if not, it would have been second meeting in June, then the first meeting in July, then it wouldn't have been, so we're still on track, and we were talking about that through this process to keep everything moving.
Okay, well, good.
All right.
Great, thank you
All right.
very much.
Thank you.
Thank you.
Next item on the agenda, excuse me, is the annual report of residential permits. Ms. Tracy Taylor, Director of Planning, Zoning, and Community Development. Thank you. Thanks, Andrew.
Yes, thank you.
Thanks for waiting.
Sure. Good afternoon, Tracy Taylor, Planning Director for Wicomico County. So I'm here today to talk about our annual report. Every year I come before the County Council about this time because our annual report is due to the state by July 1. It is a state requirement that we prepare an annual report to outline our permits division, how many building permits we get, how many subdivisions, commercial properties, and divide them into what's located in the PFA and outside the PFA, which will help, I think, some of the questions you had, Councilman Hastings, earlier in the meeting today. Obviously, I'm not going to, out of respect for your time, I'm not going to read this, but I would like to highlight some of the more important items in the report.
We have taken this to the Planning Commission as is required by state law. They made a favorable recommendation to the county council. It's the county council that actually approves the annual report, and then I send it on to the Maryland Department of Planning as a filing for Wicomico County. The cover page was page 1, so actually the information starts on page 2, and you can see that this is based off calendar years. So these numbers are January 1 through December 31, 2025. This year, we had 57 new residential permits issued. Those are new single-family units that could be anything from stick-built to manufactured to modular. They could even be a barndominium. That counts as well. As compared to last year, I thought you'd find it interesting. We had 92 last year, so we had a much higher number. Anytime your number is over 50, the state requires you to fill out this long form. If you have less than 50 new residential permits in a year, they have a much shorter form for you to fill out. So we have the long form. So 57 new residential permits, of which the bulk of those were in non-PFA. 50 out of the 57 were not in a PFA. Looking further down, it asks if we've had any amendments to zoning regulations, zoning map, and then carry over to page 3. The only thing that we had in calendar year 25 was a text amendment for the kennel legislation that you are familiar with, and then any growth-related changes, and that's just to show that we had municipal annexations last year. So in letter C, we had one water sewer plan amendment that was for the city of Fruitland, for the Minokan Aquifer, installation of 2 wells, and we had 3 annexation requests: Cedar Park, Camden Avenue for the city of Fruitland, and Chestnut Way and Pine Way, 2 separate annexations for the city of Salisbury. On page 4, one highlight to point out is that last year we could not comment that all of our boards and commissions had done the Planning Commission Board of Appeals training course, but this year they have, so very proud of that. Also, several of them have taken the open meetings law training as well. The next section I just want to touch on, section 3, talks about development capacity analysis. Historically, that was conducted by the Maryland Department of Planning. They have a model that they use that basically looks at your existing zoning, and without adopting any growth areas, it looks at how much infill potential you have. It's only for residential, not for commercial. Maryland Department of Planning hasn't done that for several years. That was the state agency that helped local government. So when we wrote our RFP for our comprehensive plan update, we included a development capacity analysis component in that, so we will be getting that in the update to our comprehensive plan, which our kickoff meeting for that is this Thursday at the Planning Commission meeting. So you'll notice that everything is NA in that section, and we made a note about that on the page that we would be addressing that in our comp plan update. On page 5, when we talk about funded agricultural land preservation and local land use goals, unfortunately, in letter A, you're going to see a lot of zeros, which was the same as last year, and that's because they only ask us to report on locally funded programs. We do not have a locally funded ag program in Wicomico County. We do participate in the Maryland Agricultural Land Preservation Foundation, but because we're no longer a certified county, we only get to retain 1/3 of the agricultural transfer tax instead of the 2/3. That is something else that I am actively working on and will be folded into some goals and recommendations in the comprehensive plan update.
Didn't
Yes.
Wicomico have TDRs?
We have a TDR program, but we do not actively, it's never been utilized the entire time that we've had it.
Okay, I think I remember.
In that same vein, I don't want to get too far off track because I could be the nerdy planner all day and talk to you about all this great stuff that I love to talk about. But we actually are the only county that's partnering with Critical Area Commission and some other environmental groups to be part of a pilot study to look at a very unique grant-funded pilot program to look at our critical area lands and a TDR program that would transfer rights from our more vulnerable critical area lands, RCA 1/20, to our less vulnerable critical area lands. So we're looking at a program. We are part of a pilot program for that, which as we get more into that, I'll certainly be happy to report to the council. So I'm excited about that opportunity. If you look further down, that's why there's zeros in that area, because we don't have a locally funded program. If you look at letter B, Our priority preservation area is about 185,000 acres, which is about 77% of the county. And we have a local land use goal, which we have a preservation goal of about 65,000 acres. That's what we're working towards preserving in the PPA, either through our MALF easements, rural legacy easements, or any other type of environmental or land preservation easements. Our annual goal is to preserve 200 acres per year as of right now, and 6,000 acres within the rural legacy area. As of this report, we have, and actually even in 2024, we met the goal of the 200 per year. This year, we met a goal beyond that. We preserved 567 acres of land this year, 257 through the MALF program, and another 310 through the rural legacy program. When the report asks us about necessary resources, we again commented, as we did last year, we need additional support from MDE with our failing individual septic system situation, and also our recertification of our Maryland Agricultural Land Preservation Program. On page 7, I just want to clarify on this chart, it can be very confusing. The Maryland Department of Planning changed this chart format after the adoption of the regulations regarding accessory dwelling units. So when you read under Table 4A, total units approved on an existing lot, that is specific to accessory dwelling units. That means you have an existing lot with an existing dwelling, and you've added a second unit to it through the ADU. We don't have anything to report in that category because right now we still have not enacted our ADU regulations. We have until October 1 to do that. So we may be reporting different numbers yet next year, but a lot of that's going to depend on how the health department views accessory dwelling units. This year, total minor subdivisions, we had 7, 5 of which were not in the PFA. Total lots approved of those 7, we had 10 lots. So we had 7 lots outside the PFA, 3 in the PFA. If you move further down to number 9, total major subdivisions approved was 1. And that was Nutters, the pond at Nutters. And that was not in a PFA, that was 16 lots. And number 14 is the total number of all new lots approved through major and minor subdivisions was 26, 23 of which were not in a PFA. So obviously the vast majority. Number 15 is the number of certificate of occupancy permits, actually issuing the permit for someone to move in a home. We're 81. A lot of that can be construction that was in the process from last year that we didn't issue the certificate of occupancy till this year. That's why the numbers can be much higher. And then the total number of residential units that were either replaced or reconstructed was 3. On page 8, again, the first chart, 4B, is dealing mostly with accessory dwelling units, and that's why you'll see a lot of zeros there. And then the rest is just a different way of reporting what was on the previous page, reporting it in percentages in net lot area. But if you go down to Table 4D, which is new information, that deals with our commercial growth. We had a total of 7 commercial site plans that we reviewed and approved, and as you can see, the vast majority was in PFA, so much different than residential. We had a gross building area approved in square footage for commercial site plans of over 86,000 square feet. And then we had 18 commercial building permits issued regarding commercial type structures or a use going in an existing building for a total gross footage total of 280,000 square feet. And those are the highlights of the report. And if you have any questions, I'd be more than happy to answer them. I should also comment, I get the good fortune of presenting this report to you, but this report was prepared by at least 8 different individuals within my department, so I want to give ample credit. We work as a team, so I'm the face of the department, but there's a lot of work that goes on behind the scenes with the staff preparing this stuff for your review and approval. Thank you.
Thank you.
So I just need for the council to approve it, and then I can forward it to the state.
Do
Do you need a consensus, or do you need like a formal approval by resolution?
I don't need a resolution, just a
Okay.
consensus.
I just wanted to clarify.
Do we have a consensus? Yes? You have a consensus, unanimous.
Thank you.
Thanks a lot. We were stuck there for a minute.
I didn't use the right words either, so I'm sorry.
Next item on the agenda is the proposed amendment to the Marathon Everside contract.
Pamela Lynn, Finance Director. So I've mentioned in the budget meetings that we were approached by Marathon. Again, we will be starting our third year with them in the fall. And we were approached, we have been paying what's called a PMPM, or a per member per month price. So basically, for all active employees and their dependents that are covered under our health insurance, we've been paying per member to utilize the facility at Marathon. And they approached us with the idea of simplifying the billing and also reducing the cost of that billing. But the billing, what that simplification would require is us to make an amendment to the contract. So I'm coming to council asking for approval to get that contract amended, where we would lower the monthly cost by about $9,000 per month, so about $108,000 for the next fiscal year. That would save us by going to this new method of billing for the Marathon contract. It would save time and effort on both ends. So right now what has to happen is that Marathon has to get a file from Care First to say who all of our members are. But Care First right now can't send us a file that's totally clean. They send us a kind of combined file that has both retirees and current, and it's only current employees who can attend Marathon. So then Marathon gets that file. Then between Marathon and ourselves, we have to scrub that file for current employees, spend time, and then on our side, we break that out by department and charge it by department and have to make sure we have the dependents in the right department. So again, by going to a flat rate on a monthly basis, we will be able to use the prior year's averages for where membership was, and it will make the billing process simpler for both Marathon and ourselves, and it will save us money. So I'm requesting council's approval to move forward with that concept. Again, we built that into the budget because it is a cost savings to the county. We will be in our third year in this next fiscal year, and we will be doing significant looking at whether or not we will be extending the contract beyond the third year, but right now we have a 3-year deal, so we have to maintain it for the fiscal 27 contract period. But we feel we might as well take the savings and advantages now.
Yeah, that's funny you said, because that was my question, whether it's been a worthwhile venture overall, but we have another year, I get it. Joe?
I was kind of going to ask the same question, other than, are we tracking how many employees are using this in relationship to how many people are using Blue Cross and Blue Shield?
I think she is.
So yes, we have monthly meetings with Marathon. We know our utilization. It is not the uptick that we wanted. We did a major push in January, and since that time we have had a growth in it, but it's still not at the levels that at least I, as the finance director, want to see. I'm looking at it on a numbers perspective. I still think it is a good product to offer, but we've had some resistance from employees saying, well, I don't want to switch over to them if it's not going to be here. Well, that's kind of a catch-22. If our employees won't use it and won't switch over, then it's not a benefit that we can continue to pay for in the future. So we have that struggle to try to convince our employees that utilization of it is a good thing, and utilization of it means that the product would continue. Katie with our HR department looks at the numbers a little bit more frequently than I do, But again, we have had an uptick since we did, Katie went out to kind of every department and met with them, and there was an uptick since January. We are continuing that. We will continue that through the open enrollment process, and to try to let employees know that versus going to an urgent care, versus going to their primary care, versus going to, if they have the stuff in their pharmacy, there's no cost to the employee to utilize Marathon. We, the county, are picking up 100% of that cost. Versus if they go to these other facilities, there is a cost and there's a copay.
Katie?
Yep. So Katie Garvin, Benefits Manager with Wicomico County. So to follow up Pam's point, we are evaluating that fiscal side of it, that cost relationship, but the feedback I hear directly from employees is the ones that are using it love it. So that feedback that we are getting is fantastic. It's just continuing that uptick of usage. The tough part from benefits is, of course, no one wants to be sick, and we're not telling people to go catch a cold to go use Marathon. So there is some ebb and flow depending on the seasons with those visits. The big push that we're doing right now is to make sure that people understand they can use it for preventative care as well as just going in for their dependents, whether or not it's a sports physical or camp physical. Some of those pediatrician's office, you're paying them not only to go for that visit, but then you are paying to have them fill out forms on your behalf. Marathon takes over that cost for those employees. They're not having to pay out any additional fees for that, as well as the model that is the same day, next day appointment. We are seeing extremely high usage on that side of it, is that our employees, when they call or go onto the app, they are able to get that appointment that day, if not the next day that is available for them. So that feedback that we're hearing is great. Again, the employees that are using it love it. So we're just trying to transition them over to realize you are actually saving money, you're receiving a high level of care from this facility and continuing to build that trust there. We in HR did not have a functioning marketing program. I would say when I came into this position, everything was based off of email. As you know, not all of our county employees have email. So as Pam mentioned, going on to these on-site visits in January, we realized that was the easiest way and the best way to build that connection and relationship with those employees, making sure that they understood what this benefit offered, but allowing them to ask questions and open up that dialogue there. So once we had those on-site meetings, we've seen that engagement increase month to month. So it's not slowed down since we started those meetings. We're just trying to see how we can increase that engagement further than what it is at now.
Question, Joe?
Yeah, I think it's a great program, but there's one thing that caught my attention when you were talking, Pam. It's really, I think it might be, people might be reluctant to be opening up their medical records to more people. When you made the comment, something about, can you go back and say what you said about it's complicated because the records have to come to us and then have to go.
Oh, no. That's just no, there is nothing that comes to us about their medical.
Okay.
The only thing that comes to us is the count of the employees.
Okay.
So we can't see through any of our healthcare relationships.
Okay.
We can't see anybody's medical diagnosis by person.
Okay.
The only thing we get is summary information about the population of our healthcare.
All right. Okay.
So what, I apologize if I gave you that impression.
No, that's fine.
It literally, what we're getting from Care First is we have, I'm totally making up numbers, 100 employees, 50 dependents, and 30 retirees. And they're sending us a file that with those counts. So we've got 150 count. That's all that's being sent to Marathon. And then Marathon is, with us, is having to weed out the retirees because they're not eligible. But it's a count and a name. And we have all of that information anyways. We have to have employees' names and their dependents.
Marathon is getting patients' information though, right?
But it's like your doctor's office
okay.
and your health insurance company. They are another contracted health insurance company, but they are not breaking any HIPAA laws by telling us a name, and we have nothing more than a name.
The other thing I had is, if you want to increase participation, you ought to open it up to retirees, or can't you do that?
So there's some issues associated with that. And so at this moment, we're trying to make it successful with the population that we have. Because again, previously, if this amendment doesn't happen, we're paying for each of those people to then also not attend. So again, having a bigger population may or may not solve our problem of having people actually utilize it. We need to have the people, we need to have a population, not a healthy is the wrong word. We need to have a population that is using it at a frequency that makes fiscal sense. And then we can look at expanding that population. But if the current population isn't going to utilize the service, it's not a service that we can continue.
Well, that's what I'm saying. If you open it up to retirees, you might get more people, right?
But again, the previous, again, if we don't adopt this amendment, we would still be paying per member per month. So we would just be adding members for not having people to attend.
Well, I'm not discouraging not approving the amendment.
Okay.
I'm just saying if you want, you know.
Let's make it popular.
How many people can come in a store, you know?
Yeah, let's make it popular though with what we've got. And because again, there's also some issues with the age of a retiree and which health plan that they are under. Because we do have two different sets of health plans associated with our retirees, because you've got the over 65 retirees and the under 65 retirees. So again, adding retirees adds a complexity that we're not yet ready to tackle.
Just to add on to that part and expand, it has been part of the conversations, but just like Pam mentioned, we have to make sure our current population in that active employee group is using it in order to then further expand that option there. And then with that over 65, just to clarify, so once someone turns 65 on that retiree coverage, they are essentially forced over into the Medicare population. They are no longer eligible at that point to utilize Marathon, and that is not our rules. That is a Medicare Marathon rule, so we can't necessarily fight back against that. So it does put us back into that question of, well, if they're still going to be cut off at a certain point, do they have that same mindset of, well, I'm 63, do I want to start using it now before I have to transition back? So it very much is a catch-22 situation there. But one of the biggest benefits, I think, with it is our employees do not have to fully transition their providers over to Marathon. They can essentially use Marathon as a second option, a second opinion, that urgent care facility. So if they're not able to get into their primary care provider, when they have a common cold, their primary care provider says, well, I can't see you for the next 3 weeks. Most of us feel better by that point. So they can call Marathon and say, hey, I need to get in. It could be spring allergies and I need to up my Claritin dose, whatever that may be, and they can get them in there sooner than their primary.
The decision is really whether or not we want to save the money right now, right?
Yes.
Because we are obligated to another year.
We are obligated to another year.
So is there a consensus? Do you need a consensus? Is that what this?
Well, I'm looking for a consensus to then bring it as a resolution for the amendment.
Everybody okay? Good. Good with it. Are they open on weekends, by the way?
Not right now. We're partnered with the Board of Education, so in our monthly calls with Marathon, we've discussed it, because one of the problems is where they're not open on a weekend, people are still going to go to an urgent care facility that is open. We have to have higher weekday appointment usage in order to expand those hours. So part of our contract with Marathon and the Board of Education is we are paying the facility costs to have that open. So if we're not having appointments come in on the weekends or that high level of usage, we don't want to pay for those costs to keep that building open. So, yeah.
It's a huge problem. Josh?
I would say I don't even know where they're located or what, anything about this. I guess, yeah, I don't even need to speak on this. I'm fine with this, go ahead. But, overall, as complicated and awful as our healthcare system is, it's just best to avoid. It is easier to take on the pain of just going through one simple path that you know works than having to fight your way through, oh, you got to do this, but then you got to file that, and then you got to call these people, and then you got to go over there. Like, I absolutely despise it with my, I don't think I could say it. So, yeah, so I'm glad that this is there. I'm good that we are saving money. But, yeah, I don't know how you can help employees through that component, but navigating the American healthcare system is one of the most challenging things you can do in the United States. So any way that you can explain that this is actually easier.
Yeah, that's what this program is designed to do.
And it is located in the building on the S-curve.
Mm-hmm.
So it is in that facility. It's actually in the same facility as what used to be Salisbury Immediate Care. So again, it's in that same building. So again, it's centrally located within the county. It's centrally located to employees that are, coming to most of the facilities, because most of our stuff is centered around Salisbury. So again, we continue to try to get the word out to our employees that this is an active benefit to them. But again, that catch-22 exists because if we don't start seeing utilization, we're going to have tough conversations in a year.
All you need is you need a resolution.
Yeah, I just want to clarify that the amendment would be effective July 1st.
Yes.
Okay.
Yeah, it would coincide with our budget.
All they have to do is experience 6 hours in the waiting room at Title Health like we did a few weeks ago, and then they'll be going to marathon.
Thank you very much, and we will bring forward the amendment.
Thank you.
Thank you.
Ashley, you made an appointment, walked in, saw me.
Next item on the agenda is the proposed amendment to the 2010 Wicomico County Comprehensive Water Sewer Plan for Pohanka Automotive Group. Everybody okay with this?
Tracy Taylor, Planning Director, Wicomico County.
Adam Corey, Deputy Director of Public Works, Wicomico County. All right. So, yeah, I'll go ahead and get started. This is the most nighttime feeling day meeting I think I've ever been in. I just want to say that. But no, I appreciate your time. Real quick this afternoon, we'll finish this one up here, folks. So this is effectively a amendment to the 2010 Comprehensive Water and Sewer Plan specifically for the properties that are known via this application as the Pohanka Kia dealership. This is on, Business Route 13. This plan had gone through the city, including for its annexation. It makes sense for this to be served by water and sewer. It's a lot of people may not be aware, but a lot of those dealerships on Route 13 are on on-site wells and on-site septic. And what almost all car dealerships have in common is almost all of them are fully paved. It's not a good idea to have your septic systems underneath asphalt. But when they're this close to public water and sewer, it's good. And this is needed for this particular company to move forward. It was reviewed through the environmental planner here under Ms. Tracy Taylor's leadership, and then we went ahead and sent up to the state the draft amendment. We have received comment back from Maryland Department of Planning and Maryland Department of the Environment with positive feedback. This one makes sense, pretty simple on its face. So effectively, based on what we have in our docket right now for this particular amendment, we would be immediately turning around to come back to you with a full resolution for adoption of a full amendment to the plan.
The only thing I have to add is it's within their municipal growth area. It's within the Wicomico County tier map is a Tier 2C, which is non-residential zoning district. And in the report I just talked to you about when I was up here earlier, and I mentioned Chestnut and Pine annexations, that was part of this development for Kia. So they've already annexed this land. It's already in the city, and they're just now trying to amend the water sewer plan to serve it. When we reviewed the annexation, we asked them to amend the water and sewer plan so that it would show it as a service area, and that's the purpose of the amendment.
Okay with moving forward?
Yes.
Oh, good. We're good.
Just so that everyone is aware, it does require 2 weeks' worth of advertising.
Yes.
Which means we're not going to be able to have that public hearing until July 7th.
Okay. You have a full packet. The only thing I will send you is a modification to I have the resolution here, but I'll resend it to you with a slight modification and the language from MDE, MDP,
Okay.
because that's the only thing I haven't sent to you.
We're going to have to, one of the things that MDE asked for
The
was
mapping.
the mapping, so we'll get our GIS group to prepare the mapping and add that to the packet.
Yep.
The map that shows the new service area designation for water and sewer.
So that's if I get you a memo by tomorrow, correct? That would be the July 7th.
Well, so we have an extra week in between meetings, between, so you have a little bit more time.
Yes, right.
Because of that.
Okay, sounds good. It might take more than by tomorrow to get those maps and everything else done, so no worries.
Thank you all for
Thank you.
Thank you all.
Thanks.
Entertain a motion to adjourn to go into closed session.
So
Second?
Second.
All in favor?
Aye.
Aye.